I'm Ken Cook with EWG, and you're joining us for the live stream of the second confirmation hearing for Robert F. Kennedy Jr. to be the Secretary of Health and Human Services under President Trump. The first hearing yesterday was in a different committee, the committee that will actually vote on his confirmation. This is a customary secondary hearing for this nomination. The committee is the Senate Health, Environment, Labor, and Pensions Committee, and a different set of senators, some overlap, will be asking questions again of Robert F. Kennedy. And we'll be joined during the course of the coverage today with a number of distinguished guests. Just a couple of things at the top. First of all, everyone in Washington and around the country, I dare say, is focused on the tragedy that unfolded last night in the airspace above Washington, D.C., just probably a mile and a half from where I'm sitting right now, taking me back 43 years to the Air Florida crash on that hit the 14th Street Bridge on another frigid January day. And our thoughts are with everyone who and their families who is involved in this terrible accident. We don't know much about it, and of course we're not here to cover it today or comment on it beyond saying it is on everyone's mind. It's absorbing the mind share and the media coverage of events in Washington today, and it's just a horrific tragedy. And I wanted to acknowledge at the top that we're all thinking about that. I am joined already now to start off with Tom Philpott, a journalist I've long admired, who has covered food and agriculture at the highest levels of investigative work for decades. It's decades, right?
We're getting on decades.
We're getting into decades now.
Yeah,
And
definitely more than one. Almost exactly 2 decades.
And Tom is a senior research analyst at Johns Hopkins Center for a Livable Future. And for many, started off, I first came across you, you were writing for Grist, reporting for
Correct.
Grist, and then I think went to Mother Jones from there. Do I have the
Yep.
sequence right, Tom?
That's it.
Yeah, and thanks for joining. We were thrilled that we could get Tom on because so much of what Robert F. Kennedy has been talking about in the run-up to these confirmation hearings, but we didn't hear a lot about it yesterday, really, is the role he sees for food and agriculture, nutrition as a vital component of health. A lot of things, as I said yesterday, sort of anodyne things that, of course, everyone believes in. We're not doing all that we could do to make center nutrition in our healthcare system, for sure, but clearly also not entirely a new topic. And also want to start off just asking you, Tom, a lot of reporting on his confirmation that relates to his statements prior to or during the campaign and during his presidential run, reference things he wants to do for agriculture, regenerative agriculture, and pesticides. And it's often missed that he doesn't have jurisdiction over many of the basic things. He said when he first told his followers that he had a handshake deal with candidate Trump, that he was going to be in charge of both HHS and USDA, and made a video saying, I'm going to be in the building. President Trump has promised me. Well, he ain't going to be in that building. But what's your thought about just starting off with the jurisdictional issues and what someone as powerful as the HHS secretary position is? I get a sense that some of his Maha followers don't realize he won't have anything to do with farm subsidies or pesticide regulation. One is at USDA, the other's at EPA. How do you explain that gap in understanding?
Well, I mean, I think we remember at the then candidate Trump's Madison Square Garden speech, he said he was going to let. This is right before the election, I think a week before the election. It was the infamous one where the guy made the remark about Puerto Rico. But Trump said he was going to let him go wild on food and health, but he wasn't going to let him go anywhere near oil.
Stay away from the oil, Bobby. Stay away. Yeah.
Exactly. It's liquid gold. And
Yes.
And so right there we see, we're going to let him do whatever he wants, but then the immediate boxing in whether there's going to be some things that are off limits to him. And he said at the hearing yesterday, Kennedy himself said that he and Trump agreed to disagree about climate change, which I think, given some of his other flip flops on the stand yesterday, it was interesting to see him hold fast to that one. But by putting him in HHS versus USDA, I think we see the continuation of the boxing in, and it seems like they have decided, people higher up in the Trump administration, that agriculture policy is too much of a third rail. They don't want to rock the boat on that, and they're continuing to box him in, and you can see it in the pick of Brooke Rollins, who comes from a sort of right-wing policy background in Texas with no farming background, no foreign policy background, really. Yeah. But she seems, in her testimony, she was put up for USDA, and her testimony, it seems as though she is very much on the Sonny Rollins, Sonny Rollins, the great saxophone player, Sonny Perdue, the Sonny Perdue line.
If only Sonny Rollins could.
Yeah, if only Sonny Rollins, who's still alive, by the way.
Yeah.
If, she's very much sort of a status quo continuation kind of a pick at USDA, with maybe some complaints about ultra-processed foods at the margins, but it doesn't seem like she's going to do anything very different. And so I think we're in a situation where, with someone like Kennedy, he's got some ideas that are fairly common sense about food and agriculture, and some ideas that are completely wackadoodle about things like vaccines and, generally speaking, public health. And he's been put in a position where he can't do much about the agricultural ones, but he could do actual real damage at HHS with the public health ones. And so I think that's kind of where we are. It'll be interesting. Ken, I know EWG digs in pretty deep to the dietary guidelines, and that's a joint HHS USDA project. And so I think there's probably some room for something interesting to happen there. But I think that in general we see him fairly boxed into places that where he can't do much to change agriculture. Long and the short of it.
Yeah, no question about that. And coming into this, if Bobby Kennedy, and I accept this premise, is as knowledgeable about the federal policy apparatus as he claims to be, and we saw him working for decades at NRDC, and after that, while he was still focused primarily on environmental protection, he comes into this endorsing President Trump, and comes into the administration knowing the wreckage that is going to be brought about elsewhere in the environmental agenda, right?
Right.
Climate, pesticides, toxic chemicals, public lands, and so forth. And I think part of certainly EWG's perspective going into this is you sort of can't claim that that's someone else doing that, and I'm innocent of it, when as the expert he is, that the Trump administration is going to mean widespread, rapid, sometimes clumsy deregulatory efforts that are the public interest community, none of whom support this candidate, but we're going to hear from today. The public interest community is going to spend probably billions of dollars, I would say, over 4 years. Again, if you look across environment, if you look across civil rights, women's reproductive health, all of the immigration, all of those topics, spending all that money playing defense at the barricades in court, that he knew that going in. And he's, so part of the context here is, if you're looking at public health, if you're looking at environmental health, the environmental roots of health, that he oftentimes says things that we agree with, that's part of the context that I think the MAHA agenda doesn't focus on. The other thing it didn't focus on, and a lot of Kennedy's cohorts in the anti-vaccine movement were angry about it, is he didn't say much about vaccines in the run-up to the election. He left that out of the MAHA agenda.
It's true. Yeah. I mean, he knows it's his political. he knows that it's it's a paradox for him. It's a source of a lot of his power and popularity, and it's a source of it's one of the reasons, by no means the only one, why he's sort of ostracized from polite political society. And so he's got to play a very delicate game with that. And I didn't see 100% of yesterday's hearings, but it sounds like he was trying pretty hard to say I'm pro-vaccine, I'm pro that sort of
directly. I mean,
yeah. But didn't he still manage to? I still have some questions at the mark. He still managed to sort of get in there that there's some questions and science that has to be worked out. But
yeah, that's right. I mean, I have yet to come across a category of medicine for which we all wouldn't like more science on side effects or health considerations or whatever. This is sort of standard fare. But he pretty much, but I'll be eager to hear what North Saunders and Jennifer Hicks have to say about this, because I'm sure you watched the hearings yesterday. Welcome. They're both from the Safe Communities Coalition and Safe Action Fund, and I want you to both say a little bit about what that is. But I would have to say, if I were coming to this with an anti-vax framework, that he pretty much disavowed before the committee everything that he said, or many of the things he said before, by saying I've never been anti-vax. Hard to really, the evidence says very much otherwise. And for me, the standout, and Senator Ron Wyden brought it up, how can you be anti-vax and petition the FDA to revoke all the emergency use authorizations for COVID? Now, I'm sure, North and Jen, you have other perspectives, that other examples. Thank you for joining us this morning. What do you have any, before we start this hearing, any takes on yesterday's hearing with respect to vaccines?
Yeah, I mean, I think he really tried hard to disavow every single anti-vaccine statement he's previously made, and so it's just a study in contradiction between what he said and what he said yesterday. And so I'm really excited for this hearing, because I think the senators are going to get a chance to really dive deeper into the issues around vaccines and other health issues.
Yeah,
Yeah,
and
how
I
about
agree.
you?
Yeah, I agree. He seemed to just deflect all of the questions about vaccines and not really give an answer, or just to say that he was pro-vaccine when, like, there is a full body of evidence. He's on record saying that he would tell someone with a baby that he didn't know not to vaccinate that baby. And so nothing speaks more loudly, I think, than that statement, but there are many, many other examples, as you said.
For sure.
And
So
I just
did
have
you
a quick
come away
question for them.
reassured that he's disavowed and that he's not going to do anything, or what? How did you? And say a little bit about your organization too.
Yeah, happy to. Just to answer your question, I think he's going to say anything that he thinks he needs to in order to get confirmed.
Yeah.
So,
So you're
our
not
organization.
reassured?
No, I'm not reassured at all. That I don't think that anything he says during the hearing will actually reflect, if he is confirmed, which I hope he isn't, any of the things that he's going to try to accomplish if he gets into the position. So, like, I think it's just continued gish galloping, right? Like, he says one thing and continues to talk and just keeps moving the needle and moving on from other issues. And so, like, he disavowed all of his prior statements yesterday, and I think we're going to see that again today. But Ken, very excited to talk about our organization if you think this is the moment.
Yeah. Can you say a few words?
Yeah, of course. So Jen and I work for Safe Communities Coalition and Action Fund. We're the nation's first pro-vaccine advocacy organization. And so we're really focused and have been focused at advancing a pro-vaccine agenda at the state house level across the country. Most of vaccine policy is set at the state house level. A lot of the funding comes from the federal level, which is why we're really concerned about RFK. But what we do is we find advocates at the state level, build campaigns around them to show up and advocate and talk to lawmakers and build relationships with them so that they have the sound science and understanding of vaccine policy when they're making decisions.
Thanks. Thank you for that. Tom, I think you were going to make an observation.
I just wanted to ask those two if, his testimony yesterday, is there an implied wink to his anti-vax followers, or are people in that are people in those anti-vax sort of communities, are they freaking out that their man has become a turncoat? What do you think? How do you think those anti-vax politics are playing out?
So
Go right ahead, Jen. Yeah.
Yeah, I don't think so, because he has long said, I'm not anti-vaccine, I'm just pro-safe vaccines. And he has said that without acknowledging that all of the vaccines that are currently available in the United States are extremely safe and very effective. And the reason that we've gotten rid of so many dangerous diseases, which he doesn't acknowledge the dangers of many of the diseases
I like your family,
that
your nephew
have been
who's a
eliminated
Florida
thanks
Gator.
to vaccines.
We'll let that go. The Senate Committee on Health,
Return to the
Education,
hearing,
Labor, and
the
Pensions will
chairman,
please come to
Senator
order.
Cassidy's.
Again, Senator Kennedy, Bobby Kennedy, I'm sorry. Thank you for appearing before the committee and for your willingness to serve our country as your family has served our country. You and I have talked at length about a variety of issues impacting Americans' health. These have been candid conversations, and I very much appreciate your willingness to engage. And there are many things you and I agree on. We're in total agreement on the need to address ultra-processed food, to reduce obesity. And obesity, of course, the leading cause of chronic disease and therefore of shorter lifespans. And this will be a priority in this committee, and I look forward to collaborating with you if you are confirmed. But it's no secret, I have some reservations about your past positions on vaccines and a couple other issues. And so we know a lot about you. I'll tell you a little bit about myself. Before I entered politics or even thought about running for office, I practiced medicine for 30 years, working in public hospitals in California and Louisiana, specializing in liver disease, caring for those who otherwise would not have had a specialist. If you will, dedicating my life to saving lives, that is, being a doctor. Now, there is a moment in my career that really informs me now. In the early 2000s, I was loading a patient onto an air ambulance, an 18-year-old young woman, to go to get a liver transplant from acute liver failure due to hepatitis B. Barely an adult, her entire life ahead of her, all the hopes and dreams she might want, the children, the grandchildren, the future generations, wiped away if she did not get to the LSU hospital in Shreveport for an emergency transplant. Now, the transplant, an invasive, in 2000, $250,000 surgery that had a 5 to 10% mortality rate, but even if she survived, would leave her with a liver transplant and hospital bills every year of $50,000. And as she took off, it was the worst day of my medical career, because I thought $50 of vaccines could have prevented this all. And that was an inflection point in my career. And since then, I've tried to do everything I can to make sure I never have to speak to another parent about their child dying due to a vaccine-preventable disease. So I worked with community and business leaders to form a public-private partnership in the capital region of Louisiana. We vaccinated 36,000 children for hepatitis B. And since the CDC and the ACIP have recommended universal vaccination for children, the number of acute hepatitis B cases in our country has declined by almost 90%. So as a physician who's been involved in immunization programs, I've seen the benefits of vaccinations. I know they save lives. I know they're a crucial part of keeping our nation healthy. Now, Bobby, I've learned you got a tremendous following. My phone blows up with people who really follow you. And there are many who trust you more than they trust their own physician. And so the question I need to have answered is, what will you do with that trust? Whether it's justified or not, and you may not want this to be the case, but I have constituents who partly credit you for their decision to not vaccinate their child. Now, that's a real conversation. And I'm hearing from them, and they want you confirmed. Now, you're going to tell us this week, as you did, I think you'll tell us today, as you did in Finance Committee yesterday, that you're pro-vaccine. So what will you tell the American mother? Will you tell her to vaccinate her child or to not? Or to have a conversation with her doctor, but for many that will be permission to not vaccinate their child. We know that to be the case. So your past of undermining confidence in vaccines with unfounded or misleading arguments concerns me. Can I trust that that is now in the past? Can data and information change your opinion, or will you only look for data supporting a predetermined conclusion? This is imperative. You will have the responsibility to restore trust in our public health institutions in this position you have. Now let's turn a little political. I want President Trump to be successful. It's important for our country. Any action you take as HHS Secretary will shape his legacy. And we both want that legacy to be positive. So thank you for coming before the committee, for being willing to serve, and I look forward to today's conversation. And with that, I yield to my ranking member, Senator Sanders.
Thank you, Senator Cassidy, Chairman. And Mr. Kennedy, thanks for being with us. I'm going to discuss later the issue of vaccines, which Senator Cassidy raised, and it's a concern, I think, to all of us. But before I go there, I wanted to congratulate you, in a sense, for the phrase, "Make America Healthy Again." I think that is a cry that all of us, a goal that all of us share, because as you have indicated, we're a very unhealthy society. We are the richest country in the history of the world, and yet we rank far below every other major country in terms of our life expectancy. That's outrageous. To me, equally outrageous is if you're working class in this country, you're going to live 6 or 7 years shorter lives than if you are rich. In America today, 68,000 people die every year because they can't get to a doctor. They can't afford to get to a doctor. You pointed out yesterday the outrageous cost of healthcare in America, 2 or 3 times more than other industrialized countries are paying. Unbelievably, in this country, hundreds of thousands of people who deal with cancer, struggling for their lives. You know what happens to them? They go bankrupt. They deplete their lives' savings. In other words, when we talk about making America healthy, you got to talk about a broken, corrupt healthcare system. Your uncle, President Kennedy, your father, Bobby Kennedy, great senator from New York, your uncle sat right now where Senator Kennedy is, Senator Cassidy is sitting, chairman of this committee. All of them did what I think is the right thing. They said healthcare is a human right. They looked all over the world. They saw every other major country guaranteeing healthcare to all people, whether they're rich or poor, young or old. So I'm not quite sure how we can move to making America healthy again unless we have the guts to take on the insurance companies and the drug companies and guarantee healthcare to all people. I'll be asking you a question about that. Lowering the cost of prescription drugs. How do you make America healthy again if 1 out of 4 people in this country cannot afford the price of prescription drugs, which is far higher in America than any other country on earth? Under President Biden, we made some progress, and this committee played an active role in having Medicare begin for the first time negotiating the price of drugs that we are paying. And I'm going to ask you whether or not you will demand that President Trump follow what we accomplished here. We are the only major country on earth not to guarantee paid family and medical leave. Mr. Kennedy, there are women today who are having babies, then they got to go back to work in a week or 2 because they have no guaranteed paid family and medical leave. How do you have a healthy country when women are forced to go back to work, when women and men get fired because they stay home taking care of their sick kids? That's not making America healthy again. And I would go a little bit beyond the jurisdiction of Health and Human Services, but I think it's important. If you are working 50 or 60 hours a week, making 13, 14 bucks an hour, which is what millions of Americans are, can you be healthy? Will you join those of us who think that in the United States, wealthiest country on earth, people work 40 hours a week, they should not live in poverty, got to raise the minimum wage to a living wage? And lastly, and we discussed this very briefly, President Trump believes that climate change is a hoax. I happen to believe, and most Americans believe, and virtually the entire scientific community believes, that it is an existential threat to this planet. I don't know how you're going to make America healthy again, or keep the world healthy, when you have massive heat waves and droughts and floods and extreme weather disturbances. Louisiana had them, Vermont had them. That's not keeping America healthy. That's not within the jurisdiction of HHS. But I surely hope that you will, if you are confirmed, demand that President Trump change his position and work with those of us who are trying to transform our energy system and, in fact, keep America healthy by addressing the crisis of climate change. Thank you, Mr. Chairman.
Thank you, Senator Sanders. And now I'd like to welcome our nominee, Mr. Robert F. Kennedy Jr. Mr. Kennedy has a long career as an attorney and advocate for various health and environmental concerns. He has championed a range of issues like healthy foods and efforts to fight chronic disease, while calling for greater transparency and accountability in our public health infrastructure. Mr. Kennedy has an important opportunity to reform the department and to restore trust in our federal health agencies. I look forward to hearing more about his policy priorities and his plans to advance President Trump's agenda to make America healthy again. I thank you for joining us today, and I'll now turn over to Mr. Kennedy to introduce himself. Is your microphone on? Is your microphone on?
Thank you, Chairman Cassidy. Thank you, Senator Sanders. Ranking members and Ranking Member Senator Sanders and other members of this distinguished committee. Cheryl and I were heartbroken last night to learn of the tragic accident that took so many of our fellow Americans, including our service members. We are in an apartment where we were able to see the rescue operations from our window. American Senator Marshall, please know that I will continue. Here you are. I'll continue to pray for you, as I texted you last night, for those who were lost, who called your state home, as well as Senators Kaine and also Brooks. We appreciate the first responders and local officials who are working so hard. May God continue to be with us all who are impacted, and those who continue to help with the recovery. I'm humbled to be sitting here today as President Trump's nominee to oversee the U.S. Department of Health and Human Services. I want to thank President Trump for entrusting me to deliver on his promise to make America healthy again. I'm grateful to have my family here once more with me. I want to introduce my wife, Cheryl, my daughter, Kik, my son, Bobby, my daughter-in-law, Amaryllis, and my nephew, Jackson Hines. I want to thank them, as well as the many members of my large extended family, for the love they have so generously shared. I want to particularly thank you, Mr. Chairman, for the time you've spent with me and the times we've talked in person and by phone. I greatly admire your passion for public health and your commitment to science. And this committee is blessed to have a medical doctor at the helm and two other medical doctors, Dr. Marshall and Dr. Rand, on the committee. I explained yesterday to the Finance Committee that my journey into the issue of health began with my career as an environmental lawyer, working with hunters and fishermen and mothers in the communities and small towns along the Hudson River. I learned that human health and environmental health are intertwined and inseparable. The same chemicals that kill fish also sicken human beings. Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than in 1960. Cancer among young people is rising by 1 or 2% per year. Autoimmune diseases, neurodevelopmental disorders, asthma, Alzheimer's, ADHD, depression, addiction, and a host of other physical and mental health conditions are all on the rise. The United States has worse health than any other developed nation. Yet we spend more on healthcare, sometimes double, sometimes triple, as other comparable nations. Last year, we spent $4.8 trillion, not counting the indirect costs from missed work. That's almost a fifth of GDP. It is tantamount to a 20% tax on the entire economy. No wonder America has trouble competing with countries that pay a third of what we do for their health care and yet have a healthier workforce. But I don't want to make this too much about money. It's the human tragedy that moves us to care. President Trump has promised to resurrect America's global strength and our leadership and to restore the American dream. And he understands that we can't be a strong nation unless we're first to healthy people. A healthy person has 1,000 dreams. A sick person has only one. Today, over half our countrymen and women are chronically ill and have only one dream. When I met with President Trump last summer, I discovered that he has more than just a concern for this tragic situation, but genuine care. President Trump has committed to restoring the American dream, and 77 million Americans delivered a mandate to do just that, due in part to his embrace and elevation of the Make America Healthy Again movement. That movement, led largely by moms from every state, many of whom have traveled to be here yesterday and today. Senators, this is one of the most powerful and transcendent movements I've ever seen. The nation is ready for change and recognizes that this is a unique inflection moment. I promised President Trump that if confirmed, I will do everything in my power to put the health of America back on track. And I've been greatly heartened to discover a deep level of care among members of this committee, both Democrats and Republicans. I came away from our conversations hopeful that we can put aside our divisions for the sake of a healthy America. For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20% of GDP, there are no good options, only bad ones. Shifting the burden around between government and industry and corporations is like changing deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change course and ask the fundamental question, why are healthcare costs so high in the first place? The obvious answer to that question is chronic disease. The CDC says over 90% of healthcare spending goes toward managing chronic disease, which hits lower income Americans the hardest. The president's pledge is not to make some Americans healthy again, but to make all Americans healthy again. There is no single culprit for chronic disease. Much as I've criticized certain industries and agencies, President Trump and I know that most of the scientists and experts genuinely care about American health. Therefore, we will bring together all stakeholders in pursuit of this unifying goal. Before I conclude, I want to make sure this committee is clear about a few things. News reports and many in the hearing yesterday have claimed that I'm anti-vaccine and anti-industry. Well, I'm neither. I'm pro-safety. I'm pro-good science. I worked for 40 years to raise awareness about mercury and other toxics in fish, and nobody called me anti-fish. All my kids are vaccinated. I believe vaccines have saved millions of lives and play a critical role in healthcare. Nor am I the enemy of food producers. American farms are the bedrock of our culture and our national security. I was a 4-H kid, and I spent my summers on ranches. I want to work with our farmers and food producers to remove burdensome regulations and unleash American ingenuity. MAHA simply cannot succeed if we do not have the partnership of America's farmers. In my advocacy, I've often disturbed the status quo by asking uncomfortable questions, and I'm not going to apologize for that. We have massive health problems in our country that we must face honestly. And the first thing I've done every morning for the past 20 years is to pray to God that he would put me in a position where I can end the chronic disease epidemic and protect our children. That's why I'm so grateful to President Trump for the opportunity to sit here before you today and seek your support and your partnership in this endeavor. I'll conclude with a promise to you, Mr. Chairman, the members of this committee, to the president, and most of all to the tens of millions of parents across America, especially the moms, who have propelled this issue to center stage. Should I be so privileged as to be confirmed, we will make sure our tax dollars support healthy foods. It will scrutinize the chemical additives to our food supply. We'll remove the financial conflicts of interest from the agencies. We'll create an honest, unbiased, science-driven HHS accountable to the president, to the Congress, and to the American people. We will reverse the chronic disease epidemic and put the nation back on the road to good health. Thank you.
Thank you, Mr. Kennedy.
So I just want to step in to say
We'll start.
that sounded
And for everyone's information,
word for
yesterday,
word
finance went
his
long.
statement yesterday.
This is not the
and,
Star Chamber. This is where I think most
and
people can get their questions out in 5
apart
minutes.
from the
And so I'll let it go a little bit over 5,
tragedy here in Washington.
but out of deference to our witness who's already testified for 3 hours, I'll be a little tight. That said, at the end, taking the ranking member and the chairman's privilege, we will have a chance, the two of us will have a chance to ask a little bit more. And that's what you get for being a chair. So that said, let's begin. Bobby, if I may, because you said I could, you had once described yourself as pro-vaccine to me. Now, the context of what I'm about to ask is that there's multiple studies establishing the safety of measles and hepatitis B vaccine, and specifically that they are not a cause of autism. In this position, and you have previously said yes, but if you are approved to this decision, to this position, will you say unequivocally, will you reassure mothers unequivocally and without qualification that the measles and hepatitis B vaccines do not cause autism?
Senator, I am not going into the agency with any.
Well, that's kind of a yes or no question, because so if you're, because the data is there, and that's kind of a yes or no. And I don't mean to cut you off, but that really is a yes or no.
If the data is there, I will absolutely do that.
Now there is the data. Just because I used to do hepatitis B, as I've said, I know the data is there.
Well, then I will be the first person. If you show me data, I will be the first person to assure the American people that they need to take those vaccines.
Now, what concerns me is that you've cast doubt on some of these vaccines recently. I mean, like the last few years, but the data, and I can quote some of it, the data has been there for a long time. I've been out of the game. I've been in Congress for 16 years, and this data was in large measure generated before I came to Congress. Yeah. So my concern is that if you were making those claims and being so influential, I mean, your bully pulpit is incredible. With that responsibility, that you never acquainted yourself with anything that might contradict that what you were previously saying. So let me ask once more. If the data is brought to you, and these studies that have been out there for quite some time and have been peer reviewed, and it shows that these two vaccines are not associated with autism, will you ask, no, I need even more? Or will you say, no, this, I see this, it's stood the test of time, and I unequivocally and without qualification say that this does not cause autism?
Not only will I do that, but I will apologize for any statements that misled people otherwise.
Thank you. Next.
And I just want to pledge to you that I will never stick on a point if somebody shows me data that says I'm wrong. I know that's an interpretation people have, but it's absolutely wrong.
I
I am
think the-
science-driven and evidence-driven.
I think the concern is how persuadable people are. But let me go on because I have limited time. I'm going to hold myself to the same 5 minutes. Yesterday, Senator Bennett in Finance asked you if you had once previously made statements that Lyme disease was created as a military bioweapon, and you said you may have said that once. Do you still believe that Lyme disease was created as a military bioweapon?
I've never believed that, Senator. What I said is that that we should always follow the evidence. And there were 3 books suggesting that. I have not read them through. What I've said is we should always follow evidence, no matter what it says. So I never have said that definitively Lyme disease was created in a biolab.
Okay. Next, again, this will be kind of a yes or no. Do you commit that you will revise any CDC recommendations only based on peer review, consensus-based, widely accepted science? In other words, not personal beliefs or the beliefs of any single person that you or your department may identify?
Absolutely, Senator. I am not going to go into HHS and impose my preordained opinions on anybody at HHS. I'm going to empower the scientists at HHS to do their job and make sure that we have good science that's evidence-based, that's replicatable, where the raw data is
I'm
published.
almost out of time, so let me get to another question.
All right.
Do you promise that FDA will not deprioritize or delay review and or approval of new vaccines, and that vaccine review standards will not change from historical norms?
Well, we will have the best vaccine standards with safety studies, and I will not, if the
That's a
panels
little bit of a
recommend-
different answer than the question I asked, because what is the best could be in the eyes of the beholder. So let me read again. Promise that the FDA will not deprioritize or delay review and or approval of new vaccines, and that vaccine review standards will not change from historical norms.
Yes.
Great. With that, I will set a good example, and I yield my time to my ranking member.
Thank you, Chairman Cassidy. And I'm going to do what I very rarely do, is actually follow up on a question from Senator Cassidy. There have been, as I understand it, dozens of studies done all over the world that make it very clear that vaccines do not cause autism. Now, you just said, if I heard correctly, well, if the evidence is there. The evidence is there. That's it. Vaccines do not cause autism. Do you agree with that?
As I said, I'm not going to go into HHS with any preordained.
I asked you a simple question, Bobby. The studies all over the world say it does not. What do you think?
Senator, if you show me those studies, I will absolutely, as I promised to Chairman Cassidy, I will apologize.
That is a very troubling response, because the studies are there. Your job was to have looked at those studies as an applicant for this job. All right. Let me ask you another question about this one, about COVID. Scientists with the Yale School of Public Health and University of Maryland have estimated that the COVID vaccine saved 3 million lives and prevented 18 million hospitalizations. President Trump, someone who I do not often agree with, has said that the COVID vaccine was, quote, one of the greatest miracles of the ages. That's Donald Trump. But Bobby, you had a very different perspective. At a time when thousands of Americans were dying from COVID every week, in May of 2021, you petitioned the Food and Drug Administration to revoke the emergency use of COVID vaccines. So my question to you is, were the scientists who told us that the COVID vaccine was imperative, and President Trump who told us that it was this great thing, were they right, or were you right when you told people that they should not take COVID shots?
Senator, I filed that lawsuit after CDC recommended the vaccine for 6-year-old children without any evidence that it would benefit them and without testing on 6-year-old children. And that was my reason for filing that lawsuit.
Was the vaccine, COVID vaccine, successful in saving millions of lives?
I don't know. We don't have a good surveillance system, unfortunately.
We don't know?
I don't think anybody can say that if you
Well,
show me
but-
science that says
But, you
that.
know, Bobby, you say, if I show you, you're applying for the job. I mean, clearly, you should know this. And that is, the scientific community has established that COVID vaccines save millions of lives, and you're casting doubt. That is really problematic. All right, let me ask you another question on another subject. My Republican colleagues and President Trump are moving toward making massive cuts into Medicaid in order to provide tax breaks for the wealthiest people in this country. As I'm sure you know, Medicaid provides health insurance to tens of millions of children, provides the funding for 2 out of every 3 seniors in nursing homes. It provides 43% of the revenue for community health centers, something I feel very strongly about. And it is so important for millions of people. If confirmed, in terms of making America healthy again, will you stand up to the White House and say, no, we cannot throw millions of children off of health care, millions of elderly people out of nursing homes. We cannot cut Medicaid to give tax breaks to billionaires.
President Trump has made no indication to me that he intends to throw millions of people out of nursing home or deprive people of their health care, Senator. We have a health care system that's broken. It's not working. You've been working on it your entire career. As Americans get less and less healthier, as premiums rose.
Bobby, I believe the healthcare system is broken. We
He has
agree on
asked
that.
me to fix it.
But
So
do
that
you
it works
fix
for
it?
the American people.
But my colleagues here, certainly in the House of Representatives, are prepared to make massive cuts in Medicaid. Now, I happen to believe in a Medicare for all system that guarantees health care to all people. Not what we're talking about. But in fact, there is serious discussion of massive cuts to Medicaid, which will have devastating harm on children, people in nursing homes. All I am asking you, if that proposal goes through, will you say, hey, you're not keeping America healthy by throwing children off of health care?
Senator, I haven't seen any of the congressional proposals. I can only tell you what President Trump has told me, which is that he wants me to make Medicaid, Medicare, and Obamacare better.
Well, if you haven't seen those proposals, I suggest you go to any newspaper. They're there. Thank you, Mr. Chairman.
Senator Paul.
You know, I think the discussion over vaccines is so oversimplified and dumbed down that we never really get to real truths. And it's why people up here are so separated from real people at home. So we talk about
I just wanna
hepatitis B. It's a
break away for
terrible
just
disease.
a
It
moment
could
here.
lead to liver failure, as the
And,
chairman said.
Comment.
But the reason you have distrust from people at home, why they don't believe
You're a little
anything you
loud
say,
there.
they don't believe government at all, is you're telling your
C-SPAN in my ear here. Yeah, thanks. Just to break away for a moment, and I want to go to North and Jen. This is the chairman, Senator Cassidy. These are the first hardball questions that have come from a Republican in 2 days of hearings. This is the first time we've seen a Republican really bear down, and he does it with great authority on the question of vaccines. And your organization, the Safe Communities Coalition, stands up for this every day. And there's all the white coats to prove it. And Jen, I know you have a PhD in related science of microbiology and related topics. What did you make, the two of you make, of Kennedy's statements today on vaccines?
I'll go first. So, you know, I thought that Senator Cassidy had such great points, especially the story he told about his patient who experienced liver cancer. And the fact that, you know, she was going to have these incredible medical bills for the rest of her life. On top of that, you know, being a transplant survivor means you're on immunosuppressive drugs for the rest of your life, which means there are certain vaccines you can no longer get. It also means that even for the vaccines you can get, your immune system is going to be suppressed. That's what those drugs do. So that person's also going to be vulnerable to other vaccine preventable diseases for the rest of her life. And as he said correctly, that could have all been prevented with a $50 vaccine. This is a really, really common infection, and it's, you know, something that we give to babies when they're very young, in their first day of life, because the earlier you get infected with hepatitis B, the more likely you're going to end up with liver cancer. So we give it early, and it is safe for those little babies. But that is something that RFK Jr. and the lawyer that he's worked with, the one who asked FDA to revoke approval of the polio vaccine, also asked them to revoke approval of the hepatitis B vaccine. He has gone to state houses, across the country, sharing misinformation about these vaccines, and honestly scaring parents about these life-saving vaccines. He says he cares about chronic diseases, but cancer is a chronic disease. The hepatitis B vaccine prevents cancer, so does the HPV vaccine.
Yeah.
So, we have these current vaccines that can prevent cancer, and there is the potential for additional vaccines that can prevent cancer. He told Senator Cassidy, he said yes, when Senator Cassidy asked him if he would commit to not changing the standards for vaccine clinical trials. But that is opposite to the rhetoric that he has said, that has come out of his organization.
For decades.
He says
Yeah.
that every vaccine should be tested. Yes, he thinks every vaccine should be tested against an inert placebo. And while that sounds good, I want you to imagine a patient with cancer and they're testing a new cancer treatment. So there's one available, right? But they want to see, is this new one, does it have less side effects, and is it more effective than what we have? You would not put that patient in a clinical trial where the placebo was inert.
Yeah.
Right? The control group would be the standard of
Completely
care treatment,
unethical to
because
do
it would
that.
be unethical to let someone go without treatment.
Yeah, that's right. If
So
you
in
have
the
an-
same
if-
way, it would be unethical if you have a new vaccine to have it go, without, the placebo would be the other vaccine that we already know is safe and effective, because you don't want to leave, especially children, vulnerable to these infectious diseases. So I have more thoughts, but I'll let North talk.
Yeah, I mean, I think it's simple. He keeps saying he's pro-science, he's pro-vaccine, but when faced with the overwhelming amount of evidence that vaccines are the best defense against these diseases, he dodges the question. So he was asked direct questions by both Senator Cassidy and Senator Sanders that he just dodged. So he said, "Bring me the evidence. The evidence is there." And so he's not willing to accept that evidence, and he wants to look at alternative studies. And that's it just goes to show that he's willing to say anything to get confirmed, but doesn't respect the scientific evidence as it's been presented to him already.
If you've written several books on vaccines, presumably you've pored over this evidence and you've come up with good reasons for rejecting it. He's acting as if he needs to be shown this evidence. And then, Tom, you made a point I saw in the notes here. I think the MAHA audience, at least those who come to it from the anti-vax perspective, were wondering where he was going to go, just like those who represent, the kind of perspective that you bring, were wondering what he's going to do. And I think that's why Bernie Sanders was clear in saying that's an unacceptable answer. But another theme he brought up, which is shocking to me in a sense, Tom, is he spent his whole career demonizing agribusiness, big farms, chemical companies. He sued pesticide companies. And now he says that we need to deregulate in agriculture and free up some magical force that presumably is going to embrace within MAHA pesticide use, which of course is not in his jurisdiction to begin with. That's EPA, and farm subsidies, that's USDA. So all the promises he made during the run-up to the election, those aren't relevant in those two areas. But say a little bit about this, because you followed this area for a long time. Then we'll jump to Senator Murray.
Yeah, I mean, if there's one thing I've learned from EWG over the years, learned from you guys, is that farming is incredibly lightly regulated. And there's this ideology that's been created by the Farm Bureau, basically, that there's these crushing burdensome regulations. And it was interesting to hear Kennedy pay lip service to that, maybe sort of. It sounded like he was almost nipping in the bud some questions he might get from Republicans. Do you hate big ag? Do you hate farmers? And so he just made in his opening statement, he just made a brief remark about how we have to unburden farmers from regulation, which is straight from the sort of Farm Bureau lexicon. And then he also, kind of went back into Maha mode and said we have to get the, the conflicts of interest out of the agencies. And that's something that, he hammered on during the campaign. He hammered on after he dropped the campaign and went MAGA, that, we have to get these conflicts of interest out. And then here we are just watching what the Trump administration is doing. And they just, about a week ago, put, two basic soybean hacks, people who work for big trade organizations that promote the soybean industry, into high positions at USDA. This happened last week. So, he's towing this Maha line, even as this other sort of, MAGA push is happening. So, I mean, to me, there are just so many contradictions within this man, what he's trying to do. So many contradictions in the MAGA agenda. He's obviously talking out of both sides of his mouth today on vaccines, as North and Jen have pointed out, that it's really hard to see how long he can last in this job, because there's just, it's hard to say how much flip-flopping one person can do. I mean, and it's basically going to be part of his job going forward.
And I'd love to add, if he's willing to disregard the overwhelming science on the vaccine front, what other overwhelming evidence is he disregarding? I think it just comes back to he is purely motivated by personal profit, personal notoriety, and he's built his career on exploiting questionable science and attracting people that are victims in this entire movement, that are being misled by him. And that's why he's here today, is because he's questioned science and then use those questions to attract followers. And I think he'll do that for vaccines, and he'll do that for every other scientific policy that he can benefit personally from.
Yeah, and I couldn't help but note that he offered he would apologize if he was wrong about vaccines at one point. I don't know how much good that will do to someone who has suffered the consequences of listening to his advice as an anti-vaccine advocate for decades, and there's no other way to put it. Let's go to Senator Murray.
Mr. Kennedy, you said that you're going to say to NIH scientists, God bless you all, thank you for your public service. We're going to give infectious disease a break for 8 years.
Excuse me?
You said you just said thank you for your service to our federal employees. You want to give infectious disease a break. That's a quote. Will you support the development and distribution of vaccines for the avian flu? Yes or no?
Will I, for the avian flu? Yes.
But my time's almost up, but having read a lot and listened to a lot, I just want to remind all my colleagues that by voting to confirm Mr. Kennedy, we would be telling our constituents he's worth listening to. That alone could get people killed before he even lifts a finger, because he does not even need the levers of power to influence people, as we saw in Samoa. All he needs is a megaphone. To affirm his views by voting to confirm him as our highest health official, we should not mince words about what that would mean. When babies die from whooping cough because parents weren't sure if the vaccine was safe, we will have to look them in the eye. When measles sweeps through school, then hospitals, nursing wards, will this be worth it? There are political realities, we all get that, but there's also right and wrong, fact and fiction. And there's also people staying healthy or dying pointlessly from diseases we can prevent because they thought Congress took its job vetting our healthcare secretary seriously. Thank you, Mr. Chairman.
We're going to now go out of order. We're going to go to Senator Marshall. He would like to be able to view the press conference regarding the tragedy on the plane from Wichita. Senator Marshall.
Well, thank you, Mr. Chairman, and thank you, Mr. Kennedy, for your kind words this morning, for your caring text last night, and I'm grateful for all my colleagues, most everybody reaching out to us, and it's certainly it's a tough day for Kansans and many others who lost loved ones, and we will look forward meeting with the president later today and those loved ones, and just want everyone back home to know that we're wrapping our arms around them, that we're mourning with them, and we'll get through this together. So thank you. Mr. Kennedy, take a second and just describe why fighting chronic disease is so important to you. Who are we fighting for? What is your role as HHS secretary? And is there anything that's a bigger priority to you than this?
I'm just going to break
Thank you, Senator.
here if I may. Can we just assert for the record that chronic disease is a problem, that we should eat healthier, and that we want Americans to be healthy again? These are none of the issues that have any traction at the policy level compared to the other things that Mr. Kennedy has put out there. The embrace of industrial agriculture and chemical companies and so forth. This is the same man who, not too many years ago, compared industrial hog farms that we've been very critical of at EWG to the Osama bin Laden of agriculture. So I don't know how you reel that back in, but he's been kept far away, as we talked about before the hearing started, Tom. He's been kept far away from USDA. And I think there have been other steps that have been taken, likewise with EPA-related issues like pesticide regulation. And so while vaccines have been central here, vaccines had really no place in the MAHA Make America Healthy Again agenda in the run-up to the election. He stayed away from those issues, even though he had this long history and had built a big part of his following around anti-vaccine posturing. Let's go back to Mr. Kennedy, see what he's talking about with respect to chronic disease.
There's never been an secretary who came in to do this. It was all about the typical partisan debate about how we allocate the cost, whether insurers pay it or whether hospitals, providers, or families pay it. And the costs continue to rise. All the things we're debating on, our kids are getting sicker and sicker.
Yeah, just to quote you from yesterday, it's like we're moving the chairs on the Titanic.
Yeah, and the ship is sinking, and nobody's paying attention to it. And yesterday, I got question after question from the Democrats about measles. In 1963, the year before the measles epidemic, or the measles vaccine was introduced, 500 American kids died from measles, almost all of them extremely poor and malnourished. We have 252 million Americans who are suffering from chronic disease, and none of them mentioned diabetes. They didn't mention heart disease. They didn't mention cancers yesterday. We need to refocus if we're going to save our country. This is existential. Our country's not going to be destroyed because we get the marginal tax rate wrong.
Right.
It is going to be destroyed if we get this issue wrong.
Break in again and go
And
to
I am
our guests here. The notion that Bernie Sanders or any of those Democratic senators have not paid attention to chronic illness and its underlying causes. We know from our work on Capitol Hill, our government affairs team, and our scientists day in and day out, that is far from the case. But it also turns out that the very essence of a chronic disease is that it's manifested long-term and that the causes are oftentimes veiled by latencies in the etiology of the diseases that make it very hard to figure out how to go about it. I don't think Bernie Sanders or anyone else has been so obsessed with dollars and cents that was divorced from the basic problem of healthcare, which is, people can't afford it. So I would love your perspective, and I just want to add one other thing. Your day job, I think, pretty much, Jen and North, is going in before state legislatures that get guidance from the CDC on vaccine policy. But the state legislatures are making the decisions, and they have been in turmoil. Vaccination rates are dropping, unfortunately, especially in some states. We talked about this yesterday on the program. There is a partisan, shocking and frightening sort of partisan divide where Republican red areas in particular the vaccination rates are going down, and we're seeing the health effects rise as a result of that. What is your take on this discussion of chronic disease being completely ignored in previous administrations, previous debates?
Yeah, so I'd just like to put it back on RFK. Like, if chronic disease is his number one issue, why did he spend the decade before he ran for president of the United States heading up an anti-vaccine organization? And so I am in complete alignment with, I think, everybody here that it's a big issue, and fixing healthcare in America is a huge, important issue that needs the attention that it's getting right now. But he's not the man to do it. He is an anti-vaxxer that headed up an anti-vaccine organization and built his public standing on that issue. And now he didn't get the traction that he wanted, and so he's had to pivot. And so vaccines is not a popular issue because the majority of Americans immunize their kids, right? And that's why he's getting so much pushback on it from the members of the committee here, is that it's not an issue that Americans want to give up. We want to keep our kids safe. And so he has to talk about a different issue and move the spotlight to something else in order to get traction. Yeah. I'd also just like to make the note that he talked about the cost of healthcare. One of the most effective ways to reduce costs is to have a high immunization rate. The cost of an outbreak and the cost of treating a disease is orders of magnitude higher.
That? Yeah.
Yeah, right. And so, if he cares about cost, why does he want to look at one of the best cost-saving mechanisms that we have in terms of disease prevention? So,
and he immunized his own kids.
Right.
Let's go to Senator Murray. I hate to cut off. I want to talk to you more than I want to hear some of the commentary here, but
thank you.
Go back to Senator Baldwin. Tammy
Vaccines to be safe and effective. So I want to give you the opportunity to set the record straight here. Are you aware of the measures in place throughout Health and Human Services to ensure vaccine safety after approval? Yes or no?
I'm aware of the VAERS system, which CDC admits it captures fewer than 1% of vaccine injuries.
So you are aware of the CDC monitoring? Are you aware of the FDA post-approval monitoring?
I'm aware of only 2 systems.
Are you aware of the vaccine safety data link?
Oh, yeah, I'm very aware of that.
Are you aware of the vaccine adverse event reporting system?
I'm aware of the vaccine safety data link that CDC keeps under a lockbox and will not let independent scientists look at it.
Are you aware of the clinical immunization safety assessment project?
As I said.
Are you aware of VSafe?
I'm aware that they're broken. And I can explain to you how each one of those is broken if you're interested. What I want to do is make sure we have gold standard science. We get the conflicts off the panels so that people, this Congress.
What I listed right now are just some of the guardrails that are in place to ensure that life-saving vaccines are safe and effective. And this is after numerous clinical trials, rigorous studies, and review by an independent panel of experts that show vaccines are safe and effective, which is available to all the public. If you want to take a second look at the science, like you have said, well, it's here, it's available, and it's conclusive. And saying anything else is undermining vaccines. To a different
and by the way, repeating what Congress found in the 2003 investigation.
Kennedy, I want to move to what I hope it will be pretty simple stuff. In general, for a drug to be considered safe, would you say that 97, 98% of people taking that drug and having no complications is generally safe?
It would completely depend on what the drug is. If it's a drug given to a healthy population, that would not be
Again, this is as high a level as it gets. Would you say that when 99 out of 100 people experience minimal or no complications, that drug is safe?
It depends what the risk is from the disease. It depends what the benefit from the drug is. If you're dying of cancer, you will take a drug with that kind of risk profile.
And if we were to
talk
about peer-reviewed,
if you're a healthy individual with zero
I'm talking
risk,
about mifepristone, but if we were to talk about peer-reviewed, replicable studies of a medication, would you say that you needed 10 trusted studies to get the same conclusion?
It
15,
depends what the
20 trusted studies?
It depends what the
What's your number?
it completely depends on the kind of study you're talking about. Randomized studies or observational studies.
Is it safe to assume that 100 studies that are replicable and peer reviewed is enough?
Well, it could be one study if it was a powerful enough study.
The most widely used medication abortion drug, mifepristone, has been FDA approved for nearly 25 years. More than 100 studies have confirmed that 99% of patients who took the abortion pill had no complications. So with all of that, I can only conclude that you would commit to keep this science-backed and proven medication on the market and accessible for women. Is that correct?
I'm going to, with mifepristone, President Trump has not chosen a policy, and I will implement his policy.
So regardless of the studies, regardless of the data, regardless of the science, you've been talking about, show me the data, show me the studies.
Well, if you
would have that policy
Senator,
regardless of what the science says.
Senator, the devil is in the details. If you're telling me 99% of women did okay, but 1% died, I would say that is not a beneficial risk profile. That is not what the studies show.
I
know, but you're not showing me. I need those details from the study before I can't buy a pig in a poke. Show me what the study says.
So let's move on. Next, it would be Senator Mullen.
Thank you, Mr. Kennedy, for being here. We have fortunately been able to form quite a friendship over the last year, and I appreciate it. Appreciate the in-depth conversations we've had. And I just want to point out, I don't understand why my colleagues all of a sudden say we can't question science. I mean, it absolutely blows my mind that all of a sudden it's such shame that Bobby's sitting up here and he's questioning science, because I guarantee you, if he was sitting here and he was going to be the Secretary of HHS underneath the former President Biden, which I enjoy saying former president, I would bet you that you guys would have his back 100% and enjoy the fact that he's questioning science. And would probably support his positions 100%. But because he's now on the Republican side, you guys have went way off the rail. And how dare he question science? My God, if we didn't question science, where would we be today? We've always questioned science. Science is always evolving, always changing. Have a glass of wine a day. It's healthy for you. Don't have a glass of wine a day. Have a piece of chocolate a day. It's healthy for you. Dark chocolate is healthy for you. Take an aspirin a day, as Senator Rand Paul pulled out. I mean, where would we be today if we didn't ever question science? But I will say there's an issue that I have as a father of six, that when my kids come.
Senator Mullen lectures Democrats about the scientific process. He's a businessman and politician from Oklahoma, and he's certainly entitled to his perspective. But I wasn't hearing people suggest that it was wrong to question science. I was hearing the questions directed to Mr. Kennedy as to what kind of science he's basing his decisions on, and when is he comfortable, when he reviews the evidence and makes evidence-based decisions, when is he comfortable reaching that conclusion? And I think that was what was frustrating, at least on the Democratic side, and maybe Senator Cassidy's side. He didn't get much of an answer. Jen, you're trained in science. Of course, questions are always important to keep coming, and of course, we don't accept. There can be a debate about what's fringe and what's frontier in asking questions about the scientific process, but the frontier questions tend to be grounded in the science, where we're asking the next iteration of them and evaluating the evidence. What do you make of this debate about how science is being portrayed in this tableau here before us?
Well, it's really worrisome, right? As a scientist, you understand that, what Mr. Kennedy said.
I think we've
That's
lost
not the
Jen
case.
there.
Science builds upon itself. One study is, am I back?
You're back.
Sorry. One study is built upon, one study is built upon the studies that came before it, right? Our existing knowledge that we have built up. So no, one study does not stand alone. It must be taken in context with what we already know. So that's very concerning that he believes one study can change everything. And I think also speaks to the fact that he has ignored lots and lots of other studies that contradict his beliefs.
Yeah. And he's obviously got the added challenge of satisfying the members of his movement who he has told, really with very few qualifications, many times before, that vaccines are unsafe and children should not be vaccinated. The statement he made about COVID vaccines in children under the age of 6. I'd love to hear your reaction to that, because it seems as if, A, children haven't died from COVID, and they have, and B, what about the kids who don't die of COVID but end up in the hospital intubated?
Yeah, well, so I'm going to answer this question not only from my perspective as a scientist, but from my perspective as a mom with small kids, because, you know, when COVID was going on, of course, you know, I'm worried about my parents who are older, but I'm also worried about my kids and what impact this could have long term, because I have an understanding, right, from the science that infections early in life
She's going.
and so
You're going
I
in and out
watched
again,
the
Jenna.
COVID vaccine trials as they were happening, as the data. I'm sorry.
You're back.
I was just saying, as a mom, you know, and as a scientist, when the COVID vaccine trials were happening, I watched those, and I watched those. I watched and waited to see what the science said about whether those vaccines were safe and effective.
Yeah, North, maybe you want to pick up there. We're having trouble with Jen.
Am I out again?
Yeah, no problem. You know, I also am the parent of young kids. You know, I have 3 little kids, and I happen to be married to a pediatrician, and that's, you know, when I saw the anti-vaccine movement really trying to question the judgment and the training of vaccine experts and medical experts, and that was what spurred me to say, like, look, we need to stand on their shoulders. I don't have a scientific background. I don't have scientific training, but I trust my wife, and I trust the medical training that she went through, and I trust experts. I recognize that science isn't perfect and it's always evolving, but right now, vaccines and the vaccines that are on the market are the best defense that we have available against these diseases. And so it's so important that we make sure that we're using them and utilizing them effectively to keep our families safe. And so, you know, he said that, you know, he brought the suit because of it being the COVID suit, because of vaccines being approved by for kids down to 6. I trust the experts to make the right decision to do that.
Yeah. Let's go to Senator Kaine from Virginia.
We take that kind of stuff pretty personally. Virginians know what happened on 9/11. And we don't need folks giving oxygen to conspiracy theories about 9/11. Now, one thing I noticed about this post is it was in July of 2024. It was 23 years after 9/11. You had a lot going on in your life. You were running for president then. What made you decide, in the midst of everything going on in this country, in this world, in July of 2024, in your own candidacy for president, that now was the time to say it's hard to tell what is conspiracy and what isn't about 9/11? What was so important about making this point in July of 2024?
Senator, the dramatic drop in trust in our government, and this is particularly one of the templates for that is what happened at CDC.
Yeah, no, I want to move aside from that. Because you say, you go on to say, I won't take sides. As president, I won't take sides on 9/11. Wow. I won't take sides on 9/11. Let me ask you this. As a general matter, do you find it hard to tell what is a conspiracy theory and what isn't? Is that kind of general deficit that you find in your own analytical abilities?
My father told me when I was 13 years old, he said, people in authority lie, and that the job of a citizen in every democracy is to maintain a fierce skepticism.
Okay, I get it.
Government authority.
And you're an authority, but you wouldn't take sides on 9/11, and you're admitting, I have a hard time telling what is a conspiracy theory and what isn't.
Senator, I haven't investigated it. If the things that I investigate, I take sides on. People are allowed to hold that opinion. I'm not going to tell them they're crazy for holding that opinion. I'm going to say, what is your evidence? And if I hear the evidence, I'm going to say that doesn't make any sense.
So you won't take sides on 9/11. Wow. Senator Murray asked you some questions about Gardasil, and this is a vaccine that's manufactured in Virginia. There's other HPV vaccines. I'm going to enter into the record a whole series of studies from many, many nations to talk about the dramatic positive effect of Gardasil. Could I introduce those into the record, Mr. Chair?
Without objection.
Those studies are
Wait, let me ask a question. Let me ask a question. These are studies from Scotland, Sweden, the UK, Australia, the United States, multiple studies. And then I'm going to introduce in the record, I guess it's a blog post of yours. The verdict is now inescapable. Gardasil is killing girls. And I'd like to introduce that into the record as well.
Without objection.
You have a pretty significant financial interest in litigation against Gardasil. You have received contingency fees and payments for referring people to lawyers suing the manufacturer. And in your ethics vetting...
I've never received any money from any Gardasil or any other vaccine lawsuit.
Let me read a quote. This is your words. In your ethics vetting for this nomination, you said, quote, pursuant to the referral agreement, I'm entitled to receive 10% of fees awarded in contingency cases referred to the firm. How can folks who need to have confidence in federal vaccine programs trust you to be independent and science-based when you stand to gain significant funding if lawsuits against vaccine manufacturers are successful?
I have given away all of my rights to any fees in that lawsuit.
I yield back.
Next is Senator Scott.
Thank you, Mr. Chairman. Mr. Kennedy, good to see you again. Thank you for being here before the committee. Yeah. One of the beauties of our country is we have foundational documents that point us in the right direction. I think it's the compass that shows us due north, true north. The Declaration of Independence mentions life, liberty, and the pursuit of happiness as unalienable rights. You and I had a serious conversation about the importance of life, and I'm a pro-life Christian, as you know. And you said that you assured me that your deputies were going to be pro-life. Is that still the case?
I will implement President Trump's policies. I serve at his pleasure, but I share President Trump's view that every abortion is a tragedy.
Now, my question was, are you having deputies within your at HHS that will be pro-life?
As I said, I can tell you exactly what I'm going to do, so there's no mistake. I'm going to implement President Trump's policies. President Trump has told me he wants to end late-term abortion.
Are you hiring people who are pro-life at HHS?
Yes, I am.
Thank you. During the first Trump administration, HHS began investing in policies to support individuals living with sickle cell anemia. This has continued. A career staff person has dedicated time to coordinate sickle cell disease-related activities across HHS and other government agencies. Will you commit to continuing to have an individual serve in this coordinating role for sickle cell?
Yes, and I think I've worked on sickle cell for many, many years. I told you I have many friends who have sickle cell. Several of them, I've seen the suffering that they endure. 1 out of every 365 Blacks in our country has sickle cell. There are now promising gene therapies. They're very, very expensive, but it's something that NIH should be enthusiastically supporting that kind of research.
Well, you answered my second question, so that's great, which was today you noticed the FDA gene therapies are really breakthrough evolutions in science that are really one-time cures. So you support the continuation of the research that makes that more available?
Absolutely, Senator.
Thank you. That's great news. This past fall, due to one facility making the majority of our IV drugs in the U.S., it was devastated by Hurricane Helene. Hospitals and healthcare facilities across the country faced IV shortages. Nephron Pharmaceuticals in Columbia, South Carolina tried to shore up IV support in South Carolina hospitals by creating the Palmetto line in its facility to help make IVs for hospitals across the state. We must do more proactively to address the shortages and the shortage risks, as well as to provide and promote the production of medical products here in the U.S. If confirmed, how will you prioritize efforts to prevent and reduce drug shortages, including for essential medicines?
Including?
Essential medicines.
President Trump has told me it's his priority to bring essential medicine manufacturing back to this country. It's a national security threat, and so much of it has been exported abroad, and particularly to China. And it's a priority for him, so it's a priority for me as well.
Very good. But you commit to fostering productive public-private.
If we can, this is all of these topics are important, but some of them are less central to, at least to the coverage that EWG was hoping to provide, which does include questions of infectious disease. Anything you heard in the recent exchanges that you wanted to comment on?
Yeah, I think he has said that he wants to completely revise the way NIH invests in medical research and infectious disease research. And, I think his comments around sickle cell, I just did a quick Google. He said that he's researched sickle cell for years. There's not a lot of evidence that I could find quickly about that. And, I just think like his posture and kind of ability to question science and have this conspiracy theory guided posture, like I think it's going to severely harm treatments just like sickle cell disease and our ability to find new treatments going into the future. And so, our lane is narrow. It's right. It's vaccines. And so we're really concerned about his position there. But I think broadly, just his, and Senator Kane's notes on 9/11, like he does believe in conspiracy theories, right? And that's evidence to it. And so, if he's basing his actions on conspiracy theories, not science, then I think we're just in a lot of trouble.
Yeah, I think.
Hey, guys, can you hear me?
Jen, anything from you?
Yeah. Backing up a little bit further to the discussion about the Gardasil vaccines and his involvement in the lawsuits. One of the things that he claims over and over again are that vaccines are liability-free products. But tell me, how can they be liability-free when he's suing manufacturers over a vaccine? That is a direct contradiction that he has to understand that he's lying. So that's just something that's very glaring that I don't know if anybody has pointed out. Yes, there's a financial conflict of interest, but there's also just the fact that he has been saying blatantly false untruths.
Yeah, there's a logic conflict as well. Let's go to Senator Murray.
Senator Warnock asked you yesterday if you had compared America's vaccine program to the Catholic Church's pedophilia scandal. You said you never said that. Now, I'm not asking you to explain what you said.
I didn't say it. Never said that.
You didn't say that. Senator
I did
Warnock,
not say that I hadn't said that, Senator. I said the other question you asked me about Nazi death camps.
That's fine. You're doubling down on that. You said Senator Warnock also asked you if you compared America's vaccine campaign to the Nazi death camps and the Holocaust. Again, you said yesterday you didn't say that.
I did not say that.
You did not say that. Senator Bennett asked you yesterday if you had made an allegation that AIDS is a different disease in Africa than it is in America. On that one, you said you didn't recall. Having had a day to think about it, do you recall saying that AIDS is a different disease in Africa than it is in the United States?
I looked up that passage in my book and found that indeed the diagnostics for AIDS are very different in Africa than in the United States, that the list of symptoms is almost completely different.
So I'll submit this for the record, but having denied the first two statements, let me just read what you said. You said in 2013, is it hyperbole to say that the people who run our vaccine programs should be in jail? They should be in jail. To me, this is like Nazi death camps. Look at what it does to the families who participate in the vaccine program. I can't tell why somebody would do something like that. I can't tell you why ordinary Germans participated in the Holocaust. I can't tell you what was going on in their minds. With respect to the pedophilia scandal, you said the pedophilia scandal in the Catholic Church is a perfect metaphor for what's happening in the United States. The vaccine program, it's the same reason we had a pedophilia scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped. I don't disagree with Senator Mullen. I don't want an HHS secretary that's not going to question science. I think it's important to question science. But you're not questioning science. You've made up your mind. You have spent your entire career undermining America's vaccine program. You make these purposeful comparisons to those that are administering the vaccine program, to the Nazi executioners, to the people who covered up the Catholic Church's pedophilia scandal, because you have made a decision that there is a comparison, that there is evil in the vaccine program as there was evil in the pedophilia scandal and the Nazi death camps. You aren't exploring science. You have made up your mind. You've spent your entire career trying to undermine these programs. This is the reason that these statements, these incredibly aggressive, over-the-top statements, matter to us, is because it just isn't believable that when you become secretary, you are all of a sudden going to be consistent with science. People who have spent their career saying these kinds of things, running the kinds of campaigns that you have run, don't all of a sudden change their stripes. And so, Mr. Chairman, I will submit these statements.
Can I respond to that, Senator?
Without objection.
My statement about the Catholic Church is almost identical. The findings of the Government Oversight Investigation Committee that investigated CDC's vaccine program in 2003. Senator Burton was chairman of that committee. And he said that that certain individuals in that program had written off a generation of kids because of, quote, misplaced institutional loyalty to the CDC and because of entanglements with the drug company. Let me finish what I'm saying. You made some grave accusations.
Pedophilia to the administration of vaccines?
No, it wasn't pedophilia. It
was a perfect metaphor.
Well, if you have 1 in 36 kids who has neurological injuries, and if that is, linked, that's something that we should study.
Is it a perfect metaphor?
It's not a perfect metaphor, but there's no metaphor that's perfect. But I am pro-vaccine. I am going to support the vaccine program. I want kids to be healthy. And I'm coming in here to get rid of the conflicts of interest within the agency, to make sure that we have gold standard evidence-based science. And if you show me where I'm wrong on this, show me a single statement I've made about science that is erroneous.
Thank you. Senator Hawley.
Thank you very much, Mr. Chairman. Mr. Kennedy, welcome. I enjoyed our conversation last month in our office. And thank you for remembering, as you did again today, my uncles who we talked about, Morris and Lauren and Jean, who all have recently passed away from Parkinson's, grew up in a farm family. That was kind of you to remember them. So thank you for that. Let me start by asking you a question about children and the safety of children. President Biden's administration, his HHS, issued a rule, so it's binding, requiring that every doctor in America, including pediatricians who receive any kind of federal funding, so that's anybody who takes ACA funding, anybody who takes CHIP funding, this is almost every health provider in America, requiring them to conduct gender transition and gender so-called affirming procedures. So that means hormones, that means puberty blockers, that means surgeries in some cases. They imposed that rule on doctors across the country. This has been litigated, and it has been actually stopped by a couple of courts who found that it was way outside of HHS's jurisdiction. My question to you is, will you rescind this rule that imposes this radical policy, and talk about being anti-science, this radical policy on just about every pediatrician in the United States of America?
Yes, I will. And by the way, that rule is anti-science. The most thorough meta review on gender affirming care has come out in the Cass report, which reports really catastrophic impacts on children. And that is science. It's a meta review of all the existing scientific studies. But, even more just from a common sense, if you're a patient, do you really want somebody performing surgery on you who is morally opposed to that surgery? It doesn't make any sense. We need to embrace diversity in this country. There are people who believe that's important. I respect them. We should hear them out. We should debate. We should have a congenial conversation. But there are also people who believe that it is an atrocity. And they need to be listened to too. And we need to embrace diversity and make room for diversity in this country and not force people to do things that are against their conscience.
And let me just point out that on this rule, what's particularly pernicious about it is we're talking about gender transition surgeries, gender transition care on minor children. This rule purported to preempt all state law. So in states like mine and many others, where the voters have said, we don't want gender transition procedures performed on minors, the Biden administration attempted to use federal money and force pediatricians to do it anyway. So I'm glad to hear you say you'll rescind that rule. I think it's terrific for the safety of children.
And Senator, I would add that we don't let children drink. We don't let them drive an automobile because they have bad judgment. They are flooded with hormones. Their brains are still in formation. Their sexuality is still in formation. To allow them to make judgments about that are going to have life-changing, forever implications for the rest of their life at that age is unconscionable, particularly in light of the Cass report.
I'm glad to hear you say that. Let me ask you a question about NIH research, if I may. I know this is something that you care a lot about. Under the first Trump presidency.
And I do want to add that people who have gender differences should be respected. They should be loved. But loving them does not sometimes love means saying no to people.
Let me, on NIH, under the first Trump presidency, HHS stopped new NIH research that involved human fetal tissue from elective abortions. Now, you were asked about this sort of tangentially yesterday by Senator Cantwell, and I want to get your quote right. You said to her correctly, you said stem cell research today can be done on umbilical cords. You don't need any fetal tissue, which is correct. My question to you is, will you reinstate President Trump's policy that ensures that no federal research and no federal tax dollars is conducted on fetal tissue taken from elective abortions?
Yes.
Fantastic. Let me ask you just about Title X. You were asked about this yesterday too, and I think I understand your answer. I just want to be sure I've got it crystal clear. Title X, which prohibits the funding of the use of federal taxpayer funding for abortions or to flow to entities like Planned Parenthood that perform abortions or refer people to abortions. You were asked yesterday if you would support President Trump's rule that says no Title X funding for those who perform abortions or refer people to abortions. I think your answer was yes, you would reinstate that rule. I just want to be sure I'm right about that.
Yes.
Fantastic. Last point that I have for you. On mifepristone, the chemical abortion drug, you said yesterday that you would study its safety. I think that's good. I want to make an additional point here just about how the Biden administration changed the rules on mifepristone that I hope that you'll take into consideration, because you pointed out, I'm almost done, Mr. Chairman, you pointed out that we need to honor the wishes of voters and states and their right to set life policy. I just point out that the Biden administration's rule on mifepristone, which they did after the Dobbs decision, means that in any state, including ones like mine, where voters or state legislators say, we don't want abortion performed after a certain point, if the Biden administration rule on chemical abortion stands and you can mail in these abortion drugs without a doctor visit or referral, that means no state ban, no state decision, no voter decision is going to matter. We're going to have a one-size-fits-all policy set here in Washington. I hope you'll take that into consideration.
I will implement President Trump's policies.
Senator Hassan.
Well, thank you, Mr. Chairman and Ranking Member Sanders. Good morning, Mr. Kennedy. Look, I want to just take a moment because, like a few of us on this dais, I sit on finance as well as help. And one of the things that was most disturbing to me about yesterday's hearing was the suggestion from some of my friends on the other side of the dais that our intense questioning and concerns about Mr. Kennedy were driven by partisanship. I have voted for 5 of President Trump's nominees to date in the last couple of weeks. One of them, the new Secretary of Transportation, was on the scene last night at DCA. Like all of us, I take really seriously our obligation for advice and consent. And I am concerned, as Senator Mullen expressed his concern, about the need for science to help us move forward on critical issues. Now, some of you are new to this committee and new to the Senate, so you may not know that I am the proud mother of a 36-year-old young man with severe cerebral palsy. And a day does not go by when I don't think about what did I do when I was pregnant with him that might have caused the hydrocephalus that has so impacted his life. So please do not suggest that anybody in this body of either political party doesn't want to know what the cause of autism is. Do you know how many friends I have with children who have autism? The problem with this witness's response on the autism cause and the relationship to vaccines is because he's relitigating and churning settled science so we can't go forward and find out what the cause of autism is and treat these kids and help these families. Mr. Kennedy, that first autism study rocked my world. And like every mother, I worried about whether, in fact, the vaccine had done something to my son. And you know what? It was a tiny study of about 12 kids. And over time, the scientific community studied and studied and studied and found that it was wrong. And the journal retracted the study because sometimes science is wrong. We make progress. We build on the work and we become more successful. And when you continue to sow doubt about settled science, it makes it impossible for us to move forward. So that's what the problem is here. It's the relitigating and rehashing and continuing to sow doubt so we can't move forward, and it freezes us in place. Now let me move on to my other concerns from yesterday's hearing. During yesterday's hearing, you really showed a lack of knowledge about Medicare and Medicaid. So what is Medicare Part A?
Medicare Part A pays mainly for primary care or physicians, and then
No,
Medicare.
so it is about, Medicare Part A is seniors coverage for inpatient hospital care. What's Medicare Part B?
For physicians and doctors. Medicare care Part D.
That is coverage for outpatient care and home health. So what is Medicare Part C?
Medicare Part C is a program where it's the full menu of all the services, A, B, C, and D for Medicare.
It is Medicare Advantage, which it's the private insurance option for seniors on Medicare. So Mr. Kennedy, you want us to confirm you to be in charge of Medicare, but it appears that you don't know the basics of this program. So let's turn to Medicaid. No, I had to correct you on several things.
Oh, you
Let's
just
turn
added
to Medicaid. Yesterday,
Senator, you didn't
said
correct me. I didn't get it wrong.
Mr. Kennedy, my time is limited, and I hope the chair will give me a
Is this
couple of more
question,
minutes.
Senator?
Yes, Medicaid.
All right, because you're
Let's
giving me
turn
very
to
little time
Medicaid.
to answer one.
Let's turn to Medicaid. Medicaid, you said yesterday to Senator Cassidy, Medicaid is fully paid for by the federal government, and it's not fee for service. That statement is false. Do you now understand that that statement is false? Yes or no?
That Medicaid is paid for by the federal government. I believe that.
You said it is fully paid for. Medicaid, in fact, sir,
Well,
is
no,
a federal state
the
partnership.
state has a partnership.
Right. So you were wrong yesterday. So you're acknowledging that
Well,
that statement was false, right?
I misstated something.
All right, good. So yesterday, when you were questioned about Medicaid, you repeatedly dodged questions by saying you want to make it better. Republicans are circulating a proposal that would end Medicaid expansion in some states, including in New Hampshire. So I will submit this for the record, but it is important to me to understand whether you believe that taking Medicaid away from 60,000 people in New Hampshire would make Medicaid better. And would it make New Hampshire healthy again? I'll submit that for the record. Thank you, Mr. Chair.
Senator Tuberville.
I want to welcome.
Thank you, Mr. Chairman.
It's Daria. Do I say that right? Daria Minovi from the Union of Concerned Scientists, and Max Goldberg, my buddy, a renowned journalist who covers everything organic in his newsletter and other publications. Daria, I just want to turn to you quickly. Say a little bit about what you do and any comments you have so far about the hearing.
Thanks for having me. So I am a senior analyst at the Union of Concerned Scientists and also a public health researcher. So within the Center for Science and Democracy, we are looking at the ways in which science is sidelined or used in federal decision-making, and also how public health regulations impact people and their families. And especially with today's hearing, we've been watching what Mr. Kennedy has been saying about sidelining scientists. There are, of course, in yesterday's hearing, there was a discussion about his previous comments about CDC scientists, and especially in light of the current gag order on federal health agencies, we want to ensure that federal scientists are able to do their job. It seems today and yesterday that he's been trying to distance himself from some of his anti-science, fringe conspiracy theories and false claims that you all have been discussing. But, it's interesting to see them continue to be raised over and over and over again. You are just reminded that this man has decades and decades of false claims made about public health, and it really shows you the stakes for public health if he is to be confirmed.
Yeah, he has a long record. Unlike the EPA nominee, unlike some others, the Secretary of Agriculture nominee, I guess now she's been confirmed. No deep background in the areas of the government that they'll be running. And Max, I don't know if you were on earlier. Tom Philpott was on and remarked on Mr. Kennedy saying that he was going to lift regulations from agriculture and work closely with chemical companies and pesticide and fertilizer companies and so forth. All the companies, many of the companies, or at least sectors that he spent many years, I think fair to say, not just criticizing. We take a backseat to no one in criticizing some of those industries at EWG, but I would say demonizing. If you refer to hog farmers in Iowa as the Osama bin Laden of agriculture, I think it's fair to say you're taking a pretty strong stand. But what do you make of that? There's no sector of agriculture that tries to work to higher standards than organic, and I know you track that day in and day out, and we follow your work closely.
Oh, well, thanks for having me, Ken, and great to be here. What he's been talking about is going after the chemical companies and him raising awareness about all the issues with what's in the foods and the chemicals, the artificial ingredients and the dyes in the foods. I think bringing awareness to that is phenomenal. In terms of organic, which is what I cover in my newsletter, Organic Insider, is he has he's a fan of regenerative. He's a fan of organic. He talked about regenerative yesterday, soil. What's of particular interest to me is obviously organic and how he's been talking about these things. But given that if it gets confirmed, he will be overseeing HHS. He said that he has a mandate from President Trump to work in conjunction with the USDA secretary. But organic, these pesticides, that does not fall under HHS.
Right.
So, that to me is the big question and mystery is if he goes after these things, we need more regulation, not less regulation of these chemicals. And so that to me is, I believe that he is very pro-organic, regenerative, soil health. He understands that. The question that I have is, how will he be able to implement and affect positive change in these areas if he's not overseeing that, USDA, EPA? That's the question I have. And I'm hopeful he's able to do something in a very positive way. Organic needs a lot of help. part of the narrative that that I hear is that, well, people should just eat organic. I don't think people have a real understanding of how organic is under such tremendous attack.
Let's go back, because Mr. Kennedy's speaking about grass, which relates to these ingredients.
Ingredients. They make the same product for Canada as all vegetable dyes, and for Europe. If you eat a McDonald's French fry in this country, it has 11 ingredients. You eat the same product in Europe, it has 3. But we are allowing these companies, because their influence over this body, over our regulatory agencies, to mass poison American children. And that's wrong. It needs to end. And I believe I'm the one person who's able to end it.
Thank you.
Senator Kim.
Thank you, Chairman. Mr. Kennedy, good to see you. I wanted to just start by asking you if you support medically assisted treatment to help people get off of opioid addiction.
Yes, I do.
Do you think it's safe, and would you consider it to be the gold standard of the approach?
The Cochrane Collaboration, which is the most prestigious scientific research organization, has said that the gold standard is, has found in studies, a gold standard is 12-step programs. You need an entire menu of treatments, because many addicts will not respond immediately, at least to 12-step programs. And for many of them, Suboxone and even methadone are critical interventions that save lives, that get addicts off the street, and they should be available as a treatment option. I wouldn't describe them as gold standard, but I would describe them as medically necessary.
Well, this is something, look, I know we all take this very seriously in terms of the plight of opioid addiction in our country. And that's something that I hope we can recognize. We need to lift up more and more. I mean, NIH has said over and over again, not enough people are doing it. And in fact, an NIH published study does call it the gold standard of treating for opioid use disorder. You're on a mission against and fighting against chronic disease. You talk a lot about obesity. I wanted to get your thoughts if you support Wegovy, Ozempic, other similar types of GLP-1 drugs to fight obesity.
The GLP-1 drugs, the GLP drugs, the class of drugs are miracle drugs. But I do not think they should be the first frontline intervention for 6-year-old kids, for whom they are currently. That is the standard of practice now. If every American who qualifies for a GLP by being overweight, 74% of our population asked for them, and the federal government was paying for it, it would cost over $1 trillion a year. It would double the insurance costs for employers in this country, and it would be a tsunami. And they have a lot of side effects.
You said you support it, but that you don't see it being the tool of choice for especially young kids.
Exactly. If for people with morbid obesity, for people with diabetes, absolutely. And they shouldn't be prescribed alone without also prescriptions for exercise, because otherwise they eat away at muscle and they're counterproductive. They go after muscle first.
Yeah.
They have all kinds of bad side effects. About half the people on GLPs get off of them after 2 years, and then there's problems when you get off them. So it is a miracle. Okay, go ahead.
Yeah, I wanted to move on to just clarify some statements you made in the past. In the past, you said, quote, Wi-Fi radiation does all kinds of bad things, including causing cancer. Do you still stand by that statement?
Yes, sir. I won a case in front of the Court of Appeals against the FCC on that very issue.
And 5G, do you feel the same way about 5G?
Well, I'm just saying electromagnetic radiation does.
And RF, you think, causes. Another issue that comes before your work, if you were to be confirmed.
And let me just clarify that. It changes DNA, and there are scientific studies that have linked it to cancer, many of them. But it does other things that are, including neurological injury, that are kind of the other frontline injuries that we're most concerned about. and that are best documented.
One other issue that comes before your work, if you're confirmed, I wanted to ask if you would support and continue and expand CDC's role in collecting and disseminating data on firearm mortality in the United States, something that
I believe that we need to study the causes of mass shootings. We need to study all the causes.
When it came to, you said earlier in response on avian flu, you would continue the investments, that you would support vaccine development. I just want to clarify, does that mean you support investments in mRNA vaccine research and development?
I'm not going to pick a vaccine right now. I need to look at all the data. I need to look at safety data and efficacy data, but I'm going to continue research on every kind of vaccine.
Mr. Chair, I yield back.
I think they're.
Thank you, Senator Kim. And now Senator Banks.
Won't be doing at HHS as secretary is finding the time to read and study and do independent analyses of data on specific vaccines. It's a 1 point whatever trillion dollar agency and all those demands. Before I wanted to circle back to a couple of points, Max, you made. Thank you for pointing out the jurisdiction question. Many journalists have missed it and have said, they repeated his promises about regulating pesticides, not in his portfolio, or somehow engaging with farm subsidy programs to move the flow of incentives in the direction of regenerative agriculture, the definition of which is, shall we say, movable and flexible. But he doesn't have jurisdiction there either. And I'm not sure many of his adherents necessarily have focused on the fact that, as he must know, you can't be an expert, a seasoned environmental policy professional, and not know that when you come into the government, you don't have king-like authority over all the areas you might like to. That belongs to the president, and the president has already appointed people, appointed someone at USDA who's brought in industry lobbyists, appointed someone to EPA. The industry lobbyists from coal and chemical industries and so forth, they're in place there, and their mantra is deregulation, which was interesting that he ventured out of his jurisdiction to say we need to reduce regulations on American farmers, which for the most part he won't have. In some areas of food safety he will, but he didn't touch on those. I don't know if those are regulations he's planning on lifting. And those are very sensitive from a public health standpoint. I'm sure Daria, UCS, has done a great deal of work in that area, and I know it's been of concern to organic because we've had issues with organic products harboring microorganisms that can cause serious illnesses, and we're all concerned about that and want to do something about it. But lifting the regulations, I'm not sure is exactly how I'd formulate it, but he didn't give all that context. Daria or Max, any comments on that?
I would just say that I agree that it is really interesting to see a lot of his narratives around chemicals, pesticides, like you said, are not in his jurisdiction. And also, I don't think that this administration is going to be friendly to making changes on those issues. We do a lot as an environmental health researcher. I did a lot of work on toxics during the last Trump administration, and we saw regulation after regulation rolled back. The administration was very friendly to petrochemical companies, to the chemical industry lobby, and I don't think that Mr. Kennedy is going to see success, even if that is an issue he has no oversight over for the most part. I don't think there's going to be a lot of movement in the direction he wants to see. And again, I just don't hear from him a lot of expertise on the issues that will be under his jurisdiction in HHS, like was just shown. He does not seem to have a lot of know-how around Medicaid and Medicare. There are just some key issues and programs that he will have oversight over that he does not seem well equipped to handle. And as he's indicated, I am concerned that he will not rely on the experts, federal scientists that are in these agencies that know best how, what the research says, how to conduct, peer-reviewed and gold standard studies. He keeps using these terms of gold standard, but his interpretation of it is absolutely not in alignment with what we are seeing from the scientists who have been sidelined now, and again happened during the last Trump administration. There were obviously a lot of tampering with scientific evidence that was put out by the CDC during the pandemic, especially. And I'm concerned that there will be an undue political influence this time around by RFK Jr. In those agencies.
Yeah. And of course, I know UCS day in and day out, and as EWG, it's not like we don't challenge authority. When we think the government's wrong, we definitely say so. We petition the government. We, engage in research and advocacy and so forth. So, but this is a slightly different. And Max, your perspective on the whole question of jurisdiction, and seems like a disconnect between what many of his followers believe he'll be doing and some basic realities of the job that he has.
Well, I have a little slightly different view on it. I don't begrudge him for saying all these things about going after all the chemicals, and because I think that probably, no one knows, but that was probably the conversation he had with President Trump when he was talking about what kind of role he wanted. Now, it doesn't appear he's not going to have that role, but I don't begrudge him for saying that he wants to do all these things, even if it's not under his official purview. So the fact that he's bringing it up I think is very positive. Now, what he will actually be able to do might be something different. So that is the question I have. But I don't begrudge him for bringing up these issues because they need to be brought up.
Yeah, I agree with you there. I don't begrudge him even on the question of cell phone. We published a peer-reviewed study where we raised concerns that cell phone safety standards are not adequate for kids. No, I agree with you there. I think my perspective is more that he must have known going into this that he was not going to be in charge of HHS and USDA, and he must have known in the reality of getting appointed to HHS that the rest of the team that was going to be brought together under Mr. Trump was going to be aggressive deregulators.
No one knows, Ken, but I would disagree. I bet you, I have a feeling he thought he was going to get overview of all of it, and then when the nominations were made, it was too late. That was it. He had to accept what he got. That's my assumption.
I've never known a joint HHS and USDA secretary, but maybe you're right. Maybe it would have been some sort of czar position. Let's go to the hearing.
Any American who the
Yes
law
or no?
says.
Yes.
I'm answering the question. Any
Yes or
American,
no was the direction.
Under the law, every American who presents to an emergency room must be treated. And I can enforce that law. And I believe that's the right thing to do.
Do you agree that a person who is experiencing severe pregnancy complications should be able to receive emergency care to save their life if that care is an abortion?
My understanding of President Trump's policy is that
I'm not asking you President Trump's policy. I'm asking you, what do you believe?
If it's necessary to save the life of the mother.
Okay, so you
of
do
course,
believe,
yes,
they should. Do you commit to ensuring that pregnant women will have access to all necessary emergency care, including an abortion, if it is required to save their life or preserve?
If it's required to save their life.
And would you agree that the ability to provide quality emergency care for pregnant women is essential to preventing maternal mortality?
Providing care for pregnant women, we should be providing care for pregnant women. President Trump wants to do that.
Bottom line for me, women should not be forced to rely on emergency airlifts to other states for life-saving care. And to be blunt, in our meeting, your lack of understanding really, again, was very concerning. In a 2023 interview, you described yourself saying, I'm a Kennedy Democrat. I believe in labor unions. I believe in a strong, robust middle class. I believe in racial justice. And just yesterday and today, during this hearing and the hearing yesterday, you said we need to respect diversity. Mr. Kennedy, the Trump administration recently issued an executive order that directs the federal government to eliminate grants, contracts, policies, programs, and activities that include diversity, equity, inclusion, and accessibility. This executive order has already caused widespread confusion, fear, and uncertainty for healthcare providers, researchers, public health professionals, and service providers across the country. You said in our meeting that you understand that health disparities exist. So yes or no, do you, in your view, do the following programs count as health DEI programs? Programs that target Black women to address the maternal mortality crisis?
Senator, there are 7.
Yes or no?
I'm not going to answer that yes or no. If you want an answer, I'm happy to give it to you, but it's not a yes
I
or
just want a yes or no.
it's not susceptible to yes or no answer.
Well, then-
if you
then-
want to
then
hear
let-
an answer, Senator.
Let me shift this because I only have 36.
If you want to hear an answer,
I've got
Senator, I'm very happy to
I've
give
got
you
now
one.
33 seconds. And there are people out here who want to understand that if they are at a pride parade and they're a healthcare provider, can they give out a brochure?
If you
They
want
wanna
people to
know
understand,
if
let me
they are
answer the
trying to have
question.
a program in a Black church that is on Martin Luther King Day. Will they be able to have that program? Will it be funded? Will they get in trouble? Will they be fired? That's the cause and concern. We all know that it is important that we have a healthy country.
You want me
as
to
you
answer the
said,
question,
health
Senator?
I think I got my answer.
Okay.
Thank you, and I yield back.
I will allow the witness to answer.
There are 7 departments at NIH that protect minority health and that seek to eliminate the shocking and unacceptable disparities in minority health. I believe in helping all people who are vulnerable. The DEI programs that President Trump eliminated have spent $63 million with no discernible positive impact on human health in this country. There's institutions already that existed before President Biden, whose job it is to do just that.
Will you cut those programs that you just referenced?
That decision is up to Congress, not to the HHS Secretary.
Thank you. I yield back.
For the record, treating a miscarriage or ectopic pregnancy is not an abortion. It's just false. And so I would ask that not be, since I'm not into misinformation, I would ask that misinformation not continually be repeated. Senator Husted.
Thank you very much. Mr. Kennedy, thank you for the.
Thank you for the work that you have done to create awareness about the food we eat and how it affects our health, particularly with our children.
I think because I think Mr. Kennedy's made a tremendous contribution raising awareness about the role of nutrition in our health and about the deplorable circumstances we face looking at highly processed, ultra-processed foods, the ingredients in there. EWG has been working on this for well over a decade, and we couldn't agree more that the FDA system is broken, that we have food coming onto the market with very little, if any, regulatory scrutiny. This has been a tremendous contribution, and I think the pointed question I would ask is, Mr. Kennedy made many promises over the campaign that he's just going to tell cereal manufacturers to get the dyes out. I guess he can walk down the hall and do that, but he hasn't said if he's going to do that. We've heard readouts from Senate meetings where he's said he's not going to go after specific ingredients. So there's some conflict there. But I applaud that. I think it's worth raising some of these concerns about fluoridation. We have worked on that for many years. We were instrumental in getting the government to cut in half the amount of fluoride put into water. So it's not that there isn't some truth there. And we were even concerned in the 90s and early 2000s, as Mr. Kennedy was, following our work on mercury in fish, about mercury in vaccines. And of course, it was decided at the end of the 90s that in fact, we were going to take mercury out of a lot of infant vaccines as a precautionary step. So there are elements of truth and legitimate argumentation, at least by my lights, in a lot of what he says. That I think that's that might be lost, and I think we want to make sure we reclaim that to his credit, that he has raised some legitimate questions that I think most of us would agree with. It's just that the weight of the questions he's raised in the context of being the head of HHS is what is creating the headwinds for him now. Anyone want to comment on that?
Yeah, I mean, I think it's great to ask questions, right? You know, we had a robust conversation about the scientific method and scientific studies, and so like ask as many questions as you want, and like let's get good answers that are scientifically supported. I think what his questions and his lack of understanding about his ability to make change coming into a role like Secretary of HHS, it just shows that how unqualified and how unknowledgeable he is about the workings of the federal government, the role and responsibilities that the Secretary of HHS has, and their ability to change things. And so, you know, I think he pandered to a lot of people around the issues of food and health in order to gain momentum for his presidential campaign and for his nomination by President Trump. And so, like, his lack of understanding about his potential influence just points to, is further evidence that he's just wholly unqualified to have this position.
Daria, what are your thoughts?
I think it's tough because he makes very reasonable statements, but they're mixed in with these completely false conspiracies. So it can be really difficult for, you know, any reasonable person to see here, you know, we need more fresh foods, people need more physical activity, all these reasonable statements about public health, but then they're distorted by junk science or, you know, partisan or profit motivated perspective. So I think that, like was just said, there are just he just appears to be very unqualified for this role. And I just don't trust that someone who's a lawyer, not a scientist, is equipped to take on the job of managing an agency of over 80,000 people. And the fact that he even just now wasn't able to provide direct answers to the senator around reproductive health care and women's access to health care is very concerning to me. You know, I was watching a video yesterday that he said that a treatment for measles is chicken soup. And that is very concerning as a parent of a young child that, you know, so I just, you know, I would just echo everything that's been said. He just does not seem ready for this role.
Yeah. Max, your thoughts? I mean, I know that you must have welcomed, as I did, this elevated discussion about the importance of cleaning up our food supply.
Well, you know, I think he's brought attention to this in a way that, I don't know, as you will know better than I can, but better than anyone, and that we're having these conversations in the government largely because of him. Yeah. And these are critical things that have not been addressed.
Yeah,
I
would only put him second to the Michelle Obama in that regard, who, you know, staked a lot of her reputation and the Obama administration's early efforts on trying to do something, and wanted to have an organic garden at the White House, and the political pressure was too much, and so I think they had to back down from that. So there have been people who've gotten into the arena, but my hat is off to Mr. Kennedy for raising these questions. Let's go to Senator Hickenlooper from Colorado.
The negotiation program, I went back and looked at that, and it was a statement that mentioned increasing transparency and then said they would solicit feedback on the Medicare drug price, but nowhere did it say in the statement that the administration was actually going to commit to lowering prices. So is that something you still feel that negotiation program and lowering those prices is important?
I've spoken to President Trump about negotiations. He's absolutely committed to negotiating lower drug prices.
Great. I appreciate that. You've also spoken much on the need to focus on prevention of chronic disease, which I think everyone shares. The MAHA movement is alive in Colorado as well as everywhere else. People are frustrated by the fact that for every dollar we spend on healthcare in this country, and it has been previously said, it's often double any other country, only a nickel goes to prevention. So when you look at that $100 billion is going to be saved over the next 10 years through the negotiation of pharmaceuticals. Do you have any ideas of how we could put that towards prevention, that revenue?
Well, that's a really good question, Senator Hickenlooper. I mean, there's two things. There's two.
I'm going to give you 40 seconds because I got two more questions.
I mean, we can do Medicaid, Medicare, and Obamacare should be we should be moving to value-based care, which includes prevention. And then the other arm is at NIH, CDC, and FDA, which should identify the toxins that are contributing to chronic disease and eliminating them.
Great. Another short question with mifepristone, which has been described and discussed a lot already. And I understand your commitment to follow the policy of the president. But he has other tools at his behest. If there needs to be another study or looking at the other existing studies, will you make sure that there's no bias to the best of our human ability to twist those results in any way to support that policy? And I'm speaking now just about the defense of science to make sure that those
Senator, I will commit to you here today to review prior to approving any study at NIH to allow you to approve the protocols and the researchers and help us choose the research. All I want is good science. And I would love input from this committee on any study that we do. There's many ways that studies are flawed, and you can correct those at the outset in a lot of ways. So absolutely, I will work with you to make sure that it's science that you're satisfied with and I'm satisfied with.
That shows that this is the first time you're being considered for a cabinet position, because no other person would ever solicit and willingly approve our participation.
Well, I'm going to make that commitment. I know the hazard of it, but I'm going to do it anyway.
I'll hold you to it. Now let me get to the vaccines, and I think this is crucial, because I think there is widespread distrust and increasing distrust in the scientific community. I am a scientist. Some have argued that I'm the only scientist in the Senate left that is actually, I've written research papers in peer-reviewed journals. I think I understand how it works, and it is a healthy skepticism is useful, but we want to make sure that's a healthy skepticism. And yesterday in the discussion about Lyme disease, you said that in your discussion that it was formulated to be a militaristic bioweapon, that you had heard that in 3 books, but you hadn't read through. And I think at a certain point, if you're going to be an activist or some people would say a prophet, that what you say becomes promoting something, promoting an idea. And I think when you've only read 3 books, or little bits of the 3 books, not the whole 3 books, isn't that reckless? I mean, isn't that there's something about, aren't you then promoting this anti-science, the conspiracy about Lyme disease in this case, but the same thing about some of these vaccine issues?
Like I said, I never endorsed the issue. I said it's out there. For me not to acknowledge that is a form of manipulation. For me to say there is no question here, the government proclaimed orthodoxy is true. Anybody who believes it is a dissident.
I'm going to have time, and I appreciate the things. I just leave it that just because we do have one out of 36 kids that, again, we can't explain what it was. It's not fair to put that blame onto all kinds of things, but focus on vaccinations. I yield back.
Dr. Moody, Senator Moody, I'm sorry.
Good morning. Thank you for joining us, and thank you for sitting down with me and spending so much time with me in my office. It has been an overwhelming week. I am the junior most senator on this committee, and certainly you treated me no differently than the chairman, and I'm grateful to you for that. One of the topics we spent a long time talking about was your assurance and knowledge and understanding that it was the states that, in fact, gave limited power to the federal government and not the other way around, and your assurance that you will not use your agency or any organization that falls under your leadership to interfere with the state's ability to set policy or any autonomy of the state to enact or enforce laws that protect the lives of the unborn. I think that that is a concern of many. It was certainly one of mine, and you allayed those concerns, and I appreciated you spending so much time with your assurances. I want to turn to some of the discussions regarding many, which would say the government and health professionals did great harm to science and medicine in the wake of COVID-19. America, I believe, is at a crossroads where unfortunately things that used to not be particularly political, like science and medicine, are now politicized to the point where reality is distorted. What you believe has little to do with truth or facts and everything to do with your party. My hope is that you, Mr. Kennedy, and President Trump's other appointees will break this cycle that is threatening America and destroying.
Open it back up to our guests here. This is an important topic of challenging authority. And I think this is something that the public interest community, in a way, prides itself on doing and doing effectively when we feel that our positions are diverge from officialdom. So I think that's, but it's also interesting to note that there are no, that I can find, no public health organizations or environmental organizations engaged in the topics that converge on the HHS portfolio, no public interest groups that support his nomination. You know, maybe you could argue that the role of public interest groups is becoming diminished over time. Separate conversation and worth having, but it is noteworthy that that is the case. And then, of course, he has tremendous support from a lot of his followers. He has significant numbers of medical doctors who have signed a petition, dwarfed by the tens of thousands and the Nobel laureates who oppose it. But this is really not politicization, as several senators have said, in a way, the question of his confirmation, because you have many of the Democratic senators who voted for 5 or more of President Trump's nominees already. So the questions of authority, questions of partisanship, I think as we begin to peel them back, there's something still different about the candidacy of Mr. Kennedy before this committee and the Finance Committee yesterday, and that seems to cleave along different issues than partisanship per se, or just unwillingness to challenge authority or unwillingness to goad science to take additional steps. Jen, we haven't heard from you for a while. I know you're there, but we had to take you off camera, unfortunately, because we weren't getting a strong signal for you. And any thoughts about that?
Yeah, thanks so much. I did want to say, you know, to the point of challenging science and to have a healthy skepticism, and one of the senators mentioned that earlier, I think that it is important to have a healthy skepticism. But I'll go back to something that Senator Hassan said, and I think it was a great point, that by trying to continuously question science that has been settled, right? And I'm talking about specifically her point on vaccines and autism, right? We have studies on hundreds of thousands of children that have been vaccinated and left unvaccinated, and clearly there's zero link. But by continuously bringing this up as a concern, really what it's doing is it's hampering our progress, right? Just exactly as she said, we need to move beyond that. We've looked into that. Scientists have looked at that. Our governments have spent millions of dollars looking into that, and lots of peer-reviewed science. And so if we want to make progress, we need to move beyond that. And he keeps saying, you know, well, if you show me the science, but the science is there, and it's for the most part, it's publicly available.
Yeah,
and so,
I don't think I've ever heard a non-scientist insist so strongly and so consistently that you have to show me the science. You don't get both. You don't get to be able to say, I'm not a scientist, and I need to see the evidence to make an independent decision, and then step back necessarily and claim I'm not a scientist, so I'm not going to be able to give that deep expert view. I know I'm not my training in science goes back many decades. Let's go to Senator Markey, and then I'll come back to you, Max, and North.
That when you went to Samoa in June of 2019, it, quote, had nothing to do with vaccines. Will you confirm again today that the trip had nothing to do with vaccines?
My purpose in going down there had nothing to do with vaccines.
Well, I have in my hand a blog post in 2021 in which you say the anti-vaccine group Children's Health Defense, which you ran, offered to fund the purpose of the trip to Samoa. And in the same post, you state that the trip was ultimately arranged by an anti-vaccine activist. And during the trip, you met with an activist who later compared vaccine mandates to Nazi Germany. And during that trip, you also discussed vaccines with the Prime Minister and the Director General of Health of Samoa. The Director General of Health said you specifically discussed your views on vaccine safety fears. And with unanimous consent, I will submit those blog posts, Mr. Chairman, into the record.
Without objection.
Can I reply to that?
I'll ask you again. Did the trip have nothing to do with vaccines, as you told my colleagues in Senate
Nothing to do with vaccines. And if you want me to explain, I will.
Did it have anything to do with vaccines?
No, it did not.
It did not. Well,
my purpose in the trip was not to. I ended up having conversations with people, some of whom I never intended to meet.
Well, again, an anti-vaxxer helped finance your trip.
Well, you call them an anti-vaxxer. That's not what they would call themselves. They call themselves safe vaccine advocates. I went down there, a CHD, which was that group, offered $6 million to obtain a grant for $6 million to install to digitalize the health records of Samoa.
Well, let me just go on. I just want to.
State-of-the-art medical informatics system. That was the purpose of my trip, Senator.
I got it. Thank you. So let me just follow through now, 2019. So now in October of 2019, the CDC declared a measles outbreak in Samoa. And in November, Samoa started a mass vaccination campaign to stop the outbreak. That same month, November of 2019, after 16 people had already died from the outbreak and Samoa was trying to respond to the crisis, you sent a letter to the Prime Minister of Samoa stating that, quote, it is a regrettable possibility that these children are causalities of the vaccine. By unanimous consent, I will introduce that letter into the record.
Without objection.
So as Samoa was trying to contain the outbreak, you were saying that it was the fault of the vaccine rather than the absence of vaccinations that caused the outbreak in Samoa in the same year you visited Samoa.
And I replied to that, Senator.
Let me just finish. The death count in Samoa grew to 83. And ultimately, volunteers in New Zealand sent tiny coffins to help bury the dozens of children who died. And the Samoan Director General of Health later said, with his last name and the status attached to it, people will believe him. People will believe Robert Kennedy. And a New Zealand vaccinologist later said the impact of your role was devastating. So your name and your profile helped fuel a measles outbreak. You scared people from taking a vaccine. It slowed the public health response, and children died. You've taken no responsibility thus far. And if an outbreak occurs in the United States, I have no evidence that you would not use your role as secretary to spread dangerous misinformation. So that one incident, from my perspective, disqualifies you from holding any position in healthcare, much less the number one health official in the United States. And 75 Nobel Prize winners in science have said very clearly that you should not be confirmed, that it would be dangerous for you to have.
And you should look at their conflicts, Senator.
So
you should look at their conflicts of those individuals.
Well, 75
and
Nobel.
You should look at who financed that letter.
75 Nobel Prize winners, and by the way, of a high percentage of the medical community in Boston, the health capital of the United States and the world have said the same thing about your qualifications. They're saying to me they don't want tiny coffins as well. Neither do I. So that's the basis of my reservations about you, and the reason why I'm going to vote no on your candidacy, because I just think it's too dangerous to run the threat that misinformation is spread in our country in the same way it was in Samoa.
Senator Murkowski, and let me compliment Mullen and Murkowski. They've stayed here the entire conference, and they're not obligated. They're not obligated to, like the two of us. Not that we wouldn't have otherwise. But Senator Murkowski, you please.
Thank you, Mr. Chairman. And I think these are exactly the types of forums that we all need to be engaged in from start to finish. Because
Can you speak up, Senator Murkowski?
There's been considerable discussion here about many issues. Certainly a lot about vaccines. I care deeply about making sure that our vaccines are safe, the efficacy of them, the availability of them, how we disseminate them is particularly important in a very, very rural state like mine. You have experience there. You understand that. I am particularly attracted by the focus on chronic diseases. We know that if we can do a better job with chronic diseases, maybe some of the other things that we are susceptible to in the infectious diseases area, we're able to perhaps pull back a little bit on that. But our reality is, in order to make this country healthy again, it is a focus on everything. It is the prevention. It is the necessity of coming up with these life-saving vaccines that are going to be so critically important. It is personal care. It is food. It is exercise. It is all of the above. And we got to figure it out together. We do need to shake some things up, but we also need to give a level of confidence. And this is what I'm hearing from so many of my colleagues who have raised the issue of vaccines. We have made some considerable gains in my state of Alaska with vaccinating the many people in very rural areas where one disease outbreak can wipe out an entire village. We saw this in 1918 with the Spanish flu, and that's why everyone was rattled to the core. Villages were shut down entirely during COVID because of the fear of transmission. And so they're looking for these life-saving ways and means. And so when there is a lack of confidence, when there is a doubt, it's like, well, what do I do? And so we're pulling back then on, again, these areas where we can work to prevent some of these deadly diseases that we thought we had wiped out years ago. We have dramatically reduced diseases in my state like Hep A and B and meningitis. We're just now getting through a tough bout of whooping cough that came around to the state. Now there's a scare in the peninsula in Alaska about a measles outbreak. So we can't be going backwards with our vaccinations that will allow for this level of prevention and protection. So I'm asking you, you are clearly an influencer. You are clearly an influencer. You would not be in this position today. But you can see how your podium, your platform, your voice can influence so many. So I am asking you on the issue of vaccines specifically to please convey with a level of authority and science, but also with a level of conviction and free of conflict and free of political bias, that these are measures that we should be proud of as a country. Proud of as a country. Look to what President Trump was able to do with the COVID vaccine. It was extraordinary, and it did save lives. I need time for a question, so I'm asking you to focus on how you can use your position to provide for greater levels of confidence to the public when it comes to these life-saving areas. So I'm going to pivot to a question that you can answer. This relates.
I can answer that one too.
No, I know, but I have 43 seconds, and no one has talked about our native populations. When you look at our health statistics, whether it's Alaska Natives or whether it is American Indians, our health statistics in this country, you know very well, because we talked about them, are not where they need to be. And it's in all categories. It's infectious disease, it's tuberculosis, it's Hep C, it's mental health, it's depression, it's substance use, it's sexually transmitted diseases, it's hypertension, stroke. It is so deep, and it is so challenging, and it is so hard. You have received support from Native American tribes. You have been in these areas. You have been quoted, and I'd like for your comment on this, as quoted saying, as far as budgeting for Indian country, you said you would immediately triple the budget to support tribes. Can you expand on this pledge and the commitment? Because this is an area where we have truly left our Native people behind when it comes to their health and their health outcomes.
Thank you, Senator.
I'm going to break away, though, if I can, for just a moment. You know, there's a tremendous overlap here, I think. I want to go specifically to you, Max, that we feel here, where a lot of people who follow Mr. Kennedy are supporters of EWG. We reach, you know, we have 35, 40 million visits to our website every year. And a lot of them are, you know, Maha moms now, or they're concerned about the same sorts of issues. And they're very concerned about chronic diseases, chronic health conditions. And, you know, chronic means long-term, habitual, and so forth. It means that we're trying to fix long-term problems by long-term changes in behavior. You know, eating healthy is not a pill. Exercising is not a visit to the doctor. These are changes in habits that you have to make when you absorb the notion that food is medicine, when you absorb the notion that activity is will extend your life and the quality of it. But then for many, it seems like, and we come across folks like this in our audience every day, this becomes a refuge from not having to vaccinate, is if we just eat right, if we just exercise and so forth. And no one was going to eat their way or exercise their way out of a COVID infection, or out of shingles, or measles, or any of the diseases that Senator Murkowski just mentioned. In our community, and Max, you've been a student of this for a long time, do you see that same sort of landscape where we're trying to navigate a combination of infectious diseases and traditional medicine, and with alternative medicine that focuses on integrative and functional concepts that are behavioral in nature? Well, how do you see that?
I don't see it being binary. I see it being, what he's doing is he's opening up the conversation about the importance of these other ways. I don't necessarily see him this being, okay, if you eat right, that'll take care of everything else. And I think where he's really been gaining a lot of traction and gaining following from people is that he is introducing these ideas that really have not been widely embraced before, and going after the food, going after the chemicals. They just, we for people who have been spending our lives fighting against, you know, the GMOs and the pesticides, this is a breath of fresh air. This is what we've been waiting for, because we know that the problems that they cause, and yet basically people within the government, we have not been listened to, and he's listening, and he agrees. And so I think that is really why people have embraced him so much, is because he is speaking to the things that we find very, very important and that impact health so much, and not so much, well, it's going to be food and get rid of the chemicals and that'll take care of everything else. I don't really think that, my sense is people don't view it that way. They view it as, here's someone who represents the views that we believe in regards to the food and the chemicals. And we heard it. Sorry?
Giving voice to them. Mm-hmm.
Giving voice to them. And I think what Senator Markey said is exactly the point. He said 75 Nobel laureates think that you are not qualified. Well, if I remember correctly, I don't know if it was 75, but there was dozens of Nobel laureates who defend GMOs.
Yeah, that's right.
So that's the argument that we're up against. And a lot of, and as RFK said, you know, he brought up, well, what about the conflict of interest? That gets completely dismissed.
Yeah.
Completely
well,
dismissed.
he has his own conflicts of interest, of course.
Yeah, well, I mean, everyone's got
direct,
conflict of interest. But I think that has been, you know, when it's our issues around the GMOs and the chemicals and the food, it just largely, they just get dismissed and are not given the importance that I think he is giving them. And I think that is why he has developed such a following. And I understand a lot of people don't find that he's the perfect candidate and have a lot of issues with him, but he's speaking to issues that a lot of us are incredible, that are very important to many of us. And he represents a voice. If he were to get in there, and going back to what we talked about earlier, well, he may not have purview over USDA and EPA. He will, if he gets in, will be a voice for the things that we care about. Now, he may not have the authority to affect change, but he will be the voice within government that will be fighting for the issues that many of us care about.
Yeah, that's right. But fair to say, he helped elect the rest of that regime. It's a team, right? We didn't elect Bobby Kennedy. We elected Donald Trump, and Donald Trump is bringing in a team that is, if history serves, anything but friendly toward the kinds of things that you and I worry about day in and day out, Max, right?
Yeah, I understand that, and I don't disagree with that. So it remains to be seen, and we'll have to see. I'm not saying that this is the panacea we've been waiting for, but that's that is what he represents, and that I think is why a lot of people embrace him.
I agree, and a lot of his ideas that I'm certainly EWG has been behind. And by the way, EWG is all over the website of Children's Health Defense, so there's overlap. Let's go to back to the hearing real quick.
That's given to whites because their immune system is better than ours. Can you please explain what you meant?
There's a series of studies, I think most of them by Poland, that show that to particular antigens that blacks have a much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Poland article suggests that blacks need fewer antigens than.
This is so dangerous.
So you get the same measles vaccine.
Mr. Kennedy, with all due respect, that is so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will be voting against your nomination because your views are dangerous to our state and to our country.
I mean, do you think science is dangerous, Senator? This is published peer-reviewed studies.
I yield.
Senator Collins, who would have been here the whole time, but she was in an Intel committee. Senator Collins.
Thank you, Mr. Chairman. Mr. Kennedy, welcome, first of all. I agree with you that there needs to be more focus on chronic diseases like diabetes, like Alzheimer's. But it concerns me when I read a quote from you that says, I'm going to say to NIH scientists, God bless you all. Thank you for your public service. We're going to give infectious diseases a break for about 8 years. Don't we need to do both?
Yes, absolutely, Senator. The problem is there's been an imbalance. We've devoted all of these dollars to infectious disease and to drug development to make NIH an incubator for the pharmaceutical industry, and very little to chronic disease. But chronic disease is 92% of deaths in our country. It's 9 out of every $10 we spend on our budget. Why aren't we devoting at least equivalent studies to determining the etiology of our chronic disease? It just seems like common sense to me.
I would point out that in many cases, it's Congress rather than HHS who sets the funding levels for various diseases.
But NIH decides, as panels that decide who gets funding, not Congress, Senator.
I want to share with you a discussion that I had with the Maine pediatric nurse practitioner. She raised the concern that if people are discouraged from getting their children vaccinated, we will lose the herd immunity in a classroom. And that means that a child who may be immunosuppressed and cannot get a vaccine are at risk of being in a classroom with an unvaccinated child, and thus at risk of getting the infectious disease because we've lost the herd immunity. What would be your response to that?
My response is that vaccine uptake for the COVID vaccine, for example, is down to 23%. And all vaccines are dropping, and they're doing that because people don't believe the government anymore. We need good science, and I'm going to bring that in. I'm going to restore trust, and that will restore vaccine uptake.
Well, you're certainly correct about what happened with the COVID vaccine, but let me switch to the polio vaccine. Do you think that the polio vaccine is safe and effective?
Yes, I do.
And so would you seek to reduce its availability in any way?
No, not at all.
The state of Maine has seen a steady and disturbing increase in Lyme disease cases over the past decade. We talked a little bit about this in my office. In 2023, Maine had a record number of Lyme disease cases, nearly 3,000 reported cases. Fortunately, there is a promising vaccine trial for Lyme disease that is underway at Maine Health in Portland. Access to a Lyme disease would be a monumental step forward in reducing the burden of this disease, which can have lifelong effects. I've seen it in members of my own family. As HHS Secretary have confirmed, what influence would you exercise over new vaccine approvals, such as one for Lyme disease?
Senator, you and I have talked about this issue. I've had Lyme disease. I lived in the epicenter of Lyme disease. Every member of my family my immediate family has had Lyme disease. I had a son whose face was paralyzed for a year. I have a son today who has been suffering with devastating effects from Lyme disease for 2 years. There's nobody who will fight harder to find a vaccine or a treatment for Lyme disease than me.
I very much appreciate that assurance, and I'm sorry that your own family has been so adversely affected. In Maine, we have a lot of people who work outside and work in the woods, and ticks are everywhere. So this is a very important issue to me. Thank you.
And to me too, Senator.
We're almost to the end. Let me acknowledge Senator Moody has also been here the whole time. And so thank you, Senator Moody.
Thank you for the recognition.
Yeah, look, just incredible diligence. Thank you. Both Senator Sanders and I will have a couple questions, and then we'll each have a closing statement, and then your long national nightmare will be over. So anyway, first, a couple more of commit type questions. If you are confirmed, do you commit that you will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs?
Yes.
And do you commit that you will not impose new grant conditions outside of congressional direction for state, local, or global entities that in any way limits, restricts, or rescinds access to vaccines or vaccine promotion programs?
Yes.
And then this is the nice thing about listening to all of this. Let me ask this. I've been impressed. One, you've handled yourself very well. I've been impressed that on many things you are familiar with recent medical data. But on other things, you haven't been. So let me bring up two things that are very pertinent now. While sitting here, I went up to look at the medical literature on these issues. And here's a title, Why Parents Say No to Having Their Children Vaccinated Against Measles, a systemic review of the social determinants of parental perceptions on MMR vaccine hesitancy. And they found that fear of autism is a major driver for vaccine hesitancy among those with a college education or higher, influenced by internet social media narratives over physician-based vaccine information. I'll go back to something I said earlier. You got to follow it, man. There's a lot of people that look to you for, do I get vaccinated or not? People that I kind of know. But here it says it's not just my anecdote, it's actually out there. But when I raised, and you said, well, if I show you the data, you'll change your, because I asked, will you unequivocally, without qualification, say that measles vaccine does not cause autism? And you said, if I show you the data.
I will publicly apologize.
So here's
and say that I was wrong.
Here's a meta-analysis from 2014, and you quoted Cochrane on several occasions, which for the people watching is a meta-analysis. A meta meaning they look at everything, and then they come to a conclusion based upon as much facts as they can get. And here is such a study. And the title tells it all. Vaccines are not associated with autism, an evidence-based meta-analysis of case control and cohort studies. And they ended up looking at 5 cohort studies with roughly 1.2 million children. Now, this is from 2014, and it has a whole bunch of articles it references. And then I got a text from a former employee of the NIH, I emphasize the former, who says that in early in the President Trump's term, you and colleagues sent 90 papers for review by people at NIH. They felt like the NIH folks felt that without exception, they were severely lacking methodologically, and are found that they indeed showed the safety of these vaccines. We tried to engage Mr. Kennedy, but his colleagues refused to acknowledge the expertise of dozens of NIH scientists we made about those papers. Now, you're a smart guy. You're reading the medical literature, and you're coming up with the recent medical literature on certain issues. But here is both older article, summarizing lots of older articles that have come out since the original refuted Wakefield article in The Lancet regarding measles and autism. And here is somebody who, it's he said, but somebody who said that previously you've had this presented to you. So back to me. I'm a doc trying to understand convince me that you will become the public health advocate, but not just churn old information so that there's never a conclusion, as Senator Hassan suggested, but that will become the influencer for people to believe, no, there's 1.25 million kids studied and there's no autism associated with measles. How do, you tell me, you see what my question is in there.
Senator, I'm going to be an advocate for strong science. You show me those scientific studies, and you and I can meet about it. And there are other studies as well, and I'd love to show those to you. There's a study that came out last week of 47,000 9-year-olds in the Medicaid system in Florida. I think a Louisiana scientist called Mawson that shows the opposite. So there are other studies out there. I just want to follow the science. And I will do, if the science says that I am wrong about what I've said in the past, as I said, I will publicly apologize. There's many times I've been wrong about science. If you look at my Instagram account, when I'm wrong, I apologize for it. And I say I was wrong. I don't have any problem. Science is a is a process of challenging hypotheses with new evidence. And scientists have to be able to admit when they're wrong. Epidemiological studies, the Institute of Medicine has said repeatedly in 2013, 2017, when they investigated this, has asked CDC to do certain studies, animal studies, bench studies, observational studies, studies of the vaccine safety data link. CDC has not done that. Oh, I want them to do that, and I want the best science. I can guarantee you, on my word of honor, that if you show me science that says that I'm wrong, I'm going to say I was wrong. I don't have any problem. There's nothing that would make me happier. We need to be able to look at the science and get IOM involved, the National Academy of Sciences. They're the ultimate arbiter of safety.
What was that?
One of the things we need to do, I think, is a subject that we haven't talked about here. Why don't we know what's causing this epidemic? Why hasn't the CDC been looking at other hypotheses to determine the etiology of why we've had this dramatic 1,000% increase in this disease that is destroying our kids? Is probably the biggest issue. Why don't we know the answer after 30 years of steady rises in autism rates? Why don't we know the answer to that? We should know the answer.
What was that? What was that last article? Did you mention
that article? Is by Mawson, Mawson.
And it's regarding measles and what?
No, it looks at the entire schedule, and it says it's a study of 9-year-old boys, 47,000 9-year-old boys from the Florida healthcare data.
Okay, let me, Senator Sanders.
Thank you. And I find myself in the unusual and uncomfortable position of having to agree with Senator Cassidy's line of questioning. Mr. Kennedy, in an interview in July 2023, you stated, quote, "I do believe autism does come from vaccines." And you have, the end of quote, and you have praised a gentleman named Andrew Wakefield for his research. What studies, you talk about the need to be science-based, to get our information, good information to make decisions. What studies have you utilized to come to the conclusion that vaccines cause autism?
I'm happy to sit down with you.
No, please, just answer me that.
I mean, look at the Mawson study, Senator.
The what? Yeah,
Mawson, just look at that study.
Yeah, I will, and that was published.
But I don't want to. I wouldn't rest on a single study.
Right.
And all studies can be better.
Okay. Don't mean to be rude. I don't have a lot of time.
Just saying.
You would not be. I just heard you say you could not be happier if you were proved wrong. Mr. Chairman, I asked to put into the record 16 studies done by scientists and doctors all over the world saying that vaccines do not cause autism. Are you happy with that objection?
Look at the IOM assessment of those 16 studies, Senator. The IOM has assessed them. But listen,
let me get to one. Don't have a lot of time. I apologize. I'm happy to talk to you at another time. I don't have a lot of time. Let's talk about COVID. And I just want clarity on the issue. And again, I apologize. You have to be brief. We don't have a lot of time. Scientists have estimated that the COVID vaccine saved 3 million lives. President Trump said COVID vaccine was, what, quote, one of the great miracles of the ages, end quote. You have said the COVID vaccine was the deadliest vaccine ever made, end of quote. Was the COVID vaccine the deadliest vaccine ever made?
The reason I said that, Senator Sanders, is because there were more reports on the VAERS system, on the Vaccine Adverse Event Reporting System, which is the only surveillance system, that and VSafe. And there were more reports of injuries and deaths than all other vaccines combined.
But was it the scientists said it saved 3 million
According
lives?
to VAERS. I don't know, because we don't have a good surveillance system.
So you disagree with the scientific community that...
Oh, I'm agnostic because we don't have the science to make that determination.
Really? Okay. Prescription drug prices in America, as you know.
And by the way, I think President Trump did an extraordinary job on warp speed because he wasn't just focusing on that one intervention. He was focusing.
He called it a miracle, but you have cast doubts on its efficacy. All right. Prescription drugs. We're going to make America healthy. I agree with you that we need a revolution in the nature of food in America, physical exercise, etc. Very, very important. But there are people who are going to get sick, and they have to go to the doctor and find out why. 1 out of 4 Americans today cannot afford the prescription drugs their doctors prescribe because we pay by far the highest prices in the world for prescription drugs. We made some progress under the Biden administration of negotiating prescription drug prices with pharma. First time that's ever happened. Now, yesterday you told me that the White House was going to issue something affirming their support for continuing those Medicare negotiations. Turned out not to be quite accurate. They came up with some bland statement, could have been written by pharma. Very specific questions. Do you believe and will you insist that Medicare continue to negotiate prices with the pharmaceutical industry so we can substantially lower prescription drug costs in America?
President Trump has made it very clear to me that he wants to negotiate.
Negotiate is a big word, Bobby. It's a big word.
It's the word you just used, Senator.
Yeah, but no, I use defend a particular law. Will you defend the law in the Inflation Reduction Act, which already is negotiating prescription drug prices?
President Trump wants us to negotiate drug pricing. He wants to lower drug prices.
So you're not telling me that you will defend the law that we passed, which has already had significant success.
Well, Congress, look, I'm going to comply with the law, Senator. Congress passed the law. I'm swearing an oath to the Constitution. I'm going to comply with the laws.
You're going to have a significant influence on healthcare policy if you are.
And I'm going to comply with the laws.
Let me just say this in conclusion, Chairman Cassidy. President Trump and Mr. Kennedy are quite right when they say that our system is broken. They're right. Our economic system today is broken. 3 people own more wealth than the bottom half of American society. Wages have been stagnant for American workers for 50 years. The economy is broken. You know what? Our political system is broken and corrupt. You have a handful of billionaires in both political parties who contribute huge amounts of money to elect candidates in this room throughout the United States Congress. That is a broken political system and a real threat to democracy. Our healthcare system is broken. And it's broken for some of the reasons that Mr. Kennedy indicated. We have not paid attention to the fact that we have massive amounts of chronic disease. We have not answered the question why in the richest country in the history of the world, our life expectancy is lower than it is in countries far poorer than we are. So I think in many ways, President Trump and Mr. Kennedy have asked some of the right questions. Problem is their answers will only make a bad situation worse. So let me ask Mr. Kennedy again. If we want to make America healthy, will you assure the American people that you will fight to do what every other major country on earth does, guarantee health care to every single American?
I'm going to make America healthier than other countries in the world right now.
Will you guarantee do what every other major country does? That's a simple question.
And by the way, Bernie, the problem of corruption is not just in the federal agencies, it's in Congress too. Almost all the members of this panel are accepting, including yourself, are accepting millions of dollars from the pharmaceutical industry.
And
protecting their interests.
Oh, I thought that would, no. I ran for president like you. I got millions and millions of contributions. They did not come from the executives, not one nickel of PAC money from the pharmaceutical industry. They came from workers.
In 2020, you were the single largest
because I had
receiver of pharmaceutical money
contributions from workers all over this country. Workers,
you were the
not a nickel from corporate
Bernie,
PACs.
you were the single largest acceptor of pharmaceutical dollars.
No, from workers in the industry.
1.5 million.
Yeah, out of 200 million. All right, but you have not answered, last question. You have not answered my question.
Mr.
How the
Chairman,
heck
we're
do we
3
make
minutes.
America, how do we make America healthy if you don't guarantee health
Chairman,
care
we're
to all
literally
people?
3 minutes over here now.
Well, so are other
How long
people.
does it keep going? At some time, you're just battering the witness,
Not
Bernie.
battering the witnesses. I'm
Yes,
trying
you
to get
are.
an
And
answer.
you're getting upset at him. You're going at him just like anybody else would.
Bernie, he's going over. Before I ever entered politics, before I was ever thinking about running for office, I practiced medicine for 30 years. I worked in public hospitals in California, Louisiana, specializing in liver disease, caring for those who otherwise would not have had a specialist. If you will, dedicating my life to saving lives. That is, being a doctor. That ethic guides me now. In my opening statement, I told the story of my patient, an 18-year-old girl with acute liver failure from hepatitis B being air ambulanced to LSU Shreveport Hospital for a liver transplant. Now, let me finish the story. Her mother wasn't allowed to fly in the helicopter, so her mother drove the 3 hours from Baton Rouge to Shreveport. Now, when she arrived, they let her visit her daughter before she went back to the OR. And the mom goes in to say a prayer, squeezes the daughter's hand. The daughter's eyes open, and she said, "Mama?" And the daughter began to recover. Powerful story with a happy ending. But as a doctor, I saw endings not so happy. I just had a friend text me, 2 children died in an intensive care unit in a Baton Rouge hospital from vaccine preventable diseases this past month. So my concern is that if there's any false note, any undermining of a mama's trust in vaccines, another person will die from a vaccine preventable disease. Now, you've got a megaphone. Maybe you and Bernie, Bobby and Bernie. Of everybody in this room, the 2 of you have the biggest followings, tremendous credibility. And with that influence comes a great responsibility. Now, my responsibility is to learn, try and determine if you can be trusted to support the best public health. A worthy movement called MAHA to improve the health of Americans, or to undermine it, always asking for more evidence and never accepting the evidence that is there. I looked at the article from Dr. Mawson, and it seems to have some issues. I'll just put that to the side. And that is why I've been struggling with your nomination. There are issues ultra-processed food, obesity, we are simpatico. We're completely aligned. And as someone who has discussed immunizations with thousands of people, I understand that mothers want reassurance that the vaccine their child is receiving is necessary, safe, and effective. We agree on that point, the 2 of us, but we've approached it differently. And I think I can say that I've approached it using the preponderance of evidence to reassure, and you've approached using selected evidence to cast doubt. Now, put differently, we're about the same age. Does a 70-year-old man, 71-year-old man who has spent decades criticizing vaccines and who's financially vested in finding fault with vaccines, can he change his attitudes and approach now that he'll have the most important position influencing vaccine policy in the United States? Will you continue what you have been, or will you overturn a new leaf at age 70? I recognize, man, if you come out unequivocally, vaccines are safe, it does not cause autism, that would have an incredible impact. That's your power. So what's it going to be? Will it be using the credibility to support lots of articles, or will it be using credibility to undermine? And I got to figure that out for my vote. You have the power to help rebuild, to help public health institutions re-earn the trust of the American people. Now, let's be political. I'm a Republican. I represent the amazing state of Louisiana. And as a patriotic American, I want President Trump's policies to succeed in making America and Americans more secure, more prosperous, healthier. But if there's someone that is not vaccinated because of policies or attitudes you bring to the department, and there's another 18-year-old who dies of a vaccine-preventable disease, helicoptered away, God forbid dies, it'll be blown up in the press. The greatest tragedy will be her death, but I can also tell you an associated tragedy that will cast a shadow over President Trump's legacy, which I want to be the absolute best legacy it can be. So that's my dilemma, man. And you may be hearing from me over the weekend. You may be hearing from me over the weekend. I once again thank you for your time, and I yield to my ranking member.
Thank you, Mr. Chairman, and thank you very much for your job today in conducting this very, very important hearing. Let me reiterate my concerns. Every person on this panel, and I would hope everybody in America, wants to make us the healthiest country on earth. And I applaud Mr. Kennedy for raising the issues and talking about some very important truths. But what I am not hearing from him are some very specific policy issues that we absolutely need if we're going to make America healthy. It is unquestionable that when 68,000 Americans die because they can't afford to go to a doctor, you got to deal with that. And I have not heard one word about the need for universal health care that exists in every country on earth. When 1 out of 4 people can't afford prescription drugs because the pharmaceutical industry is ripping us off and charging us 10 times more in some cases than the people in other countries. I have not heard the definitive answer I need that we're not going to pay the highest prices in the world for prescription drugs. And one of the points I think that Mr. Kennedy made, which is right, healthcare is not just medical care. It's a lot more. Talk about the food industry. We have held a hearing, Senator Cassidy and I held a hearing a couple of months ago, where we made the point that the food industry is in fact poisoning our kids with addictive food that is leading to obesity, diabetes, heart conditions, etc. And I hope that our Congress and the White House will have the courage to take on a very powerful food industry and demand that the products that they sell our kids are in fact healthy and non-addictive. In many ways, what the food industry is doing today is what the tobacco industry did 50 or 60 years ago. And we talk about making America healthy today. Again, it's not just doctor care, medical care. We have millions of people working for starvation wages. You cannot be healthy if you're working 50 or 60 hours a week and you can't afford the rent that your landlord is charging you. Stress kills. Stress makes us sick. So, Mr. Chairman, let me just say this. I think the issues that have been raised in this hearing today are of enormous importance. I look forward to working with you and other members of this committee to make sure that we develop the policies that have the courage to take on very powerful and wealthy special interests. So, in fact, that we can make America healthy. Thank you.
This concludes our hearing. For any senators who wish to ask additional questions for the record.
I'm just going to start with an editorial comment. I think the star of the hearing was Chairman Bill Cassidy. Wasn't expecting that I would be saying that necessarily, but I was mightily impressed. Just a couple things I wanted to bring up, and then I want to welcome Robin O'Brien for her perspective. Start with that, but first I want to hear from my colleagues North and Jen to hear Bobby Kennedy say that when some apparent standard is met, that he didn't really specify with respect to scientific evidence, that he will work to increase vaccine uptake in the population, increase vaccinations. Now, I guess that means that he'll come with you before state legislatures that are waffling on vaccination policy or rolling it back. What exactly does that mean? This is a potentially, and he didn't get there on. I think it hurt him with the chairman. He didn't get there on autism. We're going to be looking into this new study that he just mentioned. I don't know if it's on your radar. Probably is, Jen and North. We'll be looking into that to see why he brought that up and thought that this study of 9-year-old boys and vaccines is important enough to bring to a Senate hearing. But just the notion that he is completely backpedaling on his fundamental take on vaccines and autism and vaccines generally. What do you make of that?
He's not. His standards, which he has talked about before, again, are those unethical clinical trial standards, right? He wants to retest the polio vaccine with inert placebo, right? That means leaving an entire cohort of children
an arm of the study, a whole group, right?
Yes, completely unprotected and vulnerable to polio, which, you know, in this country, in the United States, in New York, there was a case of paralytic polio in 2022 that paralyzed a young man in New York in 2022. And it just so happened that the particular community that he lived in had very low vaccination rates against polio. So if we leave an entire cohort of children unprotected, we know what is going to happen because we know these vaccines. Exactly.
You recruit them and completely.
And we already know that these vaccines are safe and effective. So I don't think he's backpedaling as much as he's actually doubling down on his anti-vaccine sentiment.
So it's kind of a wink in a way to these concerns. North, your thoughts, and then I want to go to Ron real quick.
Yeah, I mean, like, if he changes his stance on vaccines and is a vaccine advocate and stands on the science and the medical studies, like, we welcome anybody who wants to champion this issue. You know, that's our issue. And I think at the end of the day, you know, I respect the folks on this call and your focus on food and toxins and Ken, you said it, like, those issues don't matter if kids are getting sick. It doesn't matter how healthy you are if you have polio or if you have measles. The best prevention is vaccines. And so, like, at the end of the day, we need someone who's going to stand up for that gold standard, right? Bobby Kennedy's words of medical prevention is vaccines and immunizing kids. And so, I think he is doing a wink and a nod to his allies. I think, you know, he's trying to distract by talking about these other very important issues to gain credibility. But at the end of the day, he is the nation's leading anti-vaxxer that has the potential to become the nation's chief health official, and it could have disastrous implications for all of our families. And you know, I hope that, you know, I was very heartened by Cassidy's introductory remarks, by Cassidy's closing remarks, and his general position. And, you know, Jen is based in Louisiana, and we've been doing a lot of work to make sure that Cassidy has the support that he needs from his home state to understand that the majority of Americans want to keep their kids healthy and safe.
Yeah. No, I think well said. Robin, welcome. I don't think there's anyone in my sphere who has listened more to moms, who has stepped into the public square and taken on authority, whether it's pesticide companies, seed companies, and others in agriculture, in the books you've written and the advocacy you've mounted. And I know you welcome the conversation about the importance of food as medicine. This is who Robin O'Brien is, if I may say. But what are your reflections from hearing? I think you were able to listen to some yesterday of the testimony and the hearing today. What's your take? And you know, you've written books about the influence of corporations on science and our health and so forth, and you've made a lot of trouble for the Monsantos of the world, among others. So, give us your take on this, Robin, and welcome.
Well, thanks, Ken. I apologize for being a few minutes late. I'm on the road this week. But I think you really have to step back and look at this as a system. and recognize that what we're talking about are symptoms of this broken system. And the food system is a symptom of a very flawed system. And that flaw is that in our country, we have failed to exercise what's called the precautionary principle. And so you can apply that to any sector, energy, food, any of them. And in the failure to exercise the precautionary principle, what we now see is the demise of the health of the American public. And I think, in these hearings, we get stuck on sort of one condition or another, but you've really got to step back and look at the entirety of this thing, look at the rates of cancer in the U.S., and it is a catastrophic issue. And when I first stepped into this almost 20 years ago, all anybody was talking about was obesity. And the data was showing that 1 in 2 men and 1 in 3 women are expected to get cancer in their lifetime, that cancer is the leading cause of death by disease in American children. I mean, these are just heart-wrenching statistics and data. And it doesn't matter what side of the aisle we're on, it impacts all of us. It doesn't matter if you're a Democrat, it doesn't matter if you're a Republican, it doesn't matter if you're an independent like I am. Right. It impacts all of us. And when someone we love dies of cancer, like, our hearts all break the exact same way. But the failure here, and sort of going at these different symptoms, we're missing the bigger picture here, which is that we have not exercised the precautionary principle. And I think it's really a national security issue, because when other countries have a healthier population, that's better for their economy, that's better for their military, that's better for their education system, that's better for the future of the country. And we have failed to do that here. And it gets sort of all wrapped up and tangled up in this universal healthcare conversation, which I'm old enough to remember when that was a Hillary Clinton talking point. And I was raised in a Texas Republican family. So that immediately makes it sound political and partisan to me. Yeah. And I think that's where we lose a lot of people. But we've got to step back and say, we all want to exercise precaution. We all want that precautionary principle in place. So let that be the governing theory. Let that be the governing mission here. And then once we put the precautionary principle in place, it doesn't matter if we're talking about stuff in our cooking equipment. It doesn't matter if we're talking about stuff in our food. We put the precautionary principle in place so that that standard is higher. And the reason that other countries operate with that guiding precautionary principle is because their healthcare system is funded by taxpayers. So imagine the hit to us, because we all know what's going on in our families. We all know what the rates of these diseases are in our families. And if we had to shoulder that as taxpayers, that burden would be tremendous. And that's the issue. So what we're talking about is actually an economic and financial issue, which I do not think has been discussed in these hearings at all. And so if we make this an economic and financial issue, what's the flip side here? So if we take that precautionary principle and all of a sudden we're all invested in making sure that we are healthy as a country together, that becomes a universal mission. That becomes something that's a shared mission, that precautionary principle. Instead, the way that the U.S. operates, which is wildly different to all of our key trading partners, which I believe is enormously detrimental to us in global finance and global import-exports, is that we have a system where sickness sells. So there is profit in absolutely every single one of these diseases. And I have taken this on. I mean, in the allergy space, launched a campaign several years ago called Epigate, because American families were paying, in some cases, $700 for an EpiPen, where you could go across the border to Canada and get it for maybe $70 or $100. And so there was price gouging that was happening because of this for-profit healthcare system that we have here. And so that, to me, is the bigger question, is that if we are truly going to make America healthy, we have to have the precautionary principle. And everything else is just putting out these little fires along the way. And so when he continues to be asked, what will you do as it relates to the health, that's the governing compass over the health of our country. And to ignore that is incredibly detrimental to all of these conversations. And so we're going to either see it in food, or we're going to see it in energy, or we're going to see it in the stuff that's going into the plastics, or we're going to see it in the stuff that's in the laundry detergent. Just like it's just going to be all these little fires. And unless we talk about this overarching issue that we've got as a country, which in my opinion puts us at a national security risk to all of our key trading partners, then we're just going to keep having these just sort of roundabout circular arguments, which is what I think this hearing is.
So if you look at the context of this particular confirmation, I found myself thinking that in a different universe, a different world, I would be intrigued by the combination of Bernie and RFK's thinking. But in this confirmation setup and the context of the Trump administration in which Kennedy will serve, combined with the complications of the issues that surround him on vaccines, among other topics, it seems like it's still a dream that we might be able to come to some common ground where we'd be making advances holistically through, more enlightened medicine that did look at the root problems, but we would also, where we can take care cost effectively and with great confidence of infectious diseases with other means. Why would we have to choose? I think it was a point you made earlier, Max, that you don't see that there has to be a divide there. But there is a divide around the vaccines question for sure. I think that's why the chairman focused on it. Robin, just real quick, and then I want to turn to others. What's your sense of your thesis in the context of Kennedy's candidacy?
I think we hear a lot of noise about the color of Fruit Loops right now, right? And the reason that other countries have banned these colors is because of that precautionary principle, is because of the universal healthcare systems that they have in place. They have a fiduciary duty and a financial obligation to keep their healthcare costs down because of the universal healthcare. So it's not the food industry that's, villainous in this case. It's this overarching, there's a universal healthcare system in place, and the incentive under that system is to keep healthcare costs down. Yeah. We don't have that incentive. Here, healthcare costs, as they keep exploding, it's more profit for the pharmaceutical industry. And again, it gets back to my background in finance. And so, I think I'm very grateful that we are having these conversations at this scale. There are a lot of people who have been at this for a really long time. There are also a lot of doctors who have been at this for a really long time. And I think what my concern is a little bit is that it's starting to feel very opportunistic. I use this term because it's how it's starting to feel to me, that ambulance chaser. And I think we have to be really careful, because the call here is for radical transparency. And I have always erred on the side of radical transparency. I don't care if we're talking about food, I don't care if we're talking about pharmaceutical, that we need that radical transparency. But I think the science here is going to be critical. And, Ken, as you know better than anybody, as a soil scientist, that science is always evolving, yes. Yeah. But I think the responsibility as a leader in the space is to continue to push for the transparency, to continue to ask these necessary questions, and recognize that we have a responsibility to the health of our children. And I'm not sure that that is entirely understood here. And I think my concern is with someone who has been able to sort of get away with things over and over and over and over again, the responsibility isn't there. And, I think
that came through in the chairman's question. I think he was trying to help Kennedy come to a conclusion on a key matter, autism and vaccines, and he couldn't really get him there.
Well, I think it's, again, it's like, you heard Kennedy say, I was wrong, but there are consequences to that. Yeah. There are consequences.
That an apology is not enough to fix, really. I think, right. I think that was the drama of the story that the chairman told at the beginning of the hearing, and as he finished it at the end. I think that calls from.
And I think we really do, yesterday with the Finance Committee, we really do have to really examine financial conflicts of interest. Yeah. I believe that completely.
No question.
I think there should be wild transparency around that. We often joke like NASCAR drivers have their logos all over their white jackets. We really should be seeing that with some of our politicians. We need that kind of transparency as Americans, because that money is just flushing through the system.
Yeah.
And really,
I want to turn to my other guests here. Thank you, Robin, and just ask for any closing observations that you want to make as we complete our coverage here. Thank you for joining. So I'll start. I'm looking at my screen, and Jen, you're the first. I see. So let's go with Jen, and then North, and then Max. I'll turn to you.
Thanks so much, Ken. I think, you know, what we saw was Kennedy over and over again ignore the current science and he kept saying things like, show me the science, when the science is existing. And as Senator Cassidy pointed out, it's not necessarily even new science, right? Yeah. It's science that we've all had time to look at, especially for somebody who is going up for this position of Secretary of HHS, that it is something they should have looked at and be familiar with. So the fact that he's not is concerning. And yeah, the one study that he did brought up has already been debunked by several scientists and physicians. And so I know you said you guys were going to look into that, and I'm happy to share some information on that.
I know it's not in a peer-reviewed journal.
No, it's not.
It's in a WordPress blog. And this was introduced as against the studies that the chairman was citing. I don't have a full understanding of those, but we'll look into it. I mean, I think Mr. Kennedy deserves that, but the fact that he brought that particular study up as a counter to all the others, we would be, look, at EWG, if we thought we were worried about mercury and thimerosal in the 90s because we got worried about mercury in fish. And by the way, people did accuse Bobby of being anti-fish, and we were accused of being anti-fish too because we raised concerns about mercury in fish. And the people who accused us of that were the commercial fisheries. But anyway, I just think that there's these divergences here. We ought to have room to discuss them and look at them openly and go over them. But yeah, Jen, I take your point. North, your closing thoughts. Oh.
Point.
Yeah, we got your sound
now.
Yep.
Okay,
yep.
Great. Yeah, that, like, you have to look at the financial conflicts of interest that he refused to say that he would give up any funding from suing the companies that he intends to regulate. And so I think the idea of him being an ambulance chaser and making the most of every opportunity for his own personal gain, there's just further evidence in this hearing about, like, he's just out here for himself. He's willing to say anything to gain power and prestige. And at the end of the day, he's unqualified for this position for a whole host of reasons, vaccine issues chief among them. But really, like, he's going to oversee a huge budget and a huge number of people. And I just don't think he has the character or qualifications to run that massive part of the U.S. government.
Max, I'll turn to you. Thank you for joining us. You're probably have deadlines you have to meet, so I really appreciate your time and your intellect in wrestling with all these questions. What do you make at the end here of it all?
I just look at it as, and I agree with Robin, that we do not have the precautionary principle in this country, and we see it in food and we see it with the chemicals, and I'm sure it is embedded into how pharmaceuticals and drugs are approved as well. And the question, if I were a senator, I would be asking, are we going to be better off or worse off with him? We could roll out someone who's got a more clean profile with vaccines and probably could care less about food and won't do anything about food or the chemicals. Whereas RFK is going to, hopefully, if he gets in, really force the issue with these other things that are serious problems. And continuing with the status quo is really a nightmare scenario.
Absolutely.
And I think that is, and it seems like there are a lot of people that just want to continue with the status quo. And that is, I understand a lot of people have questions about RFK, but that's what I grapple with is, are we just going to continue with more of the same and the quote unquote credentialed people and the safe things? And continue with the exact same health crisis we have. And as Robin alluded to, people being very sick in this country is very profitable. And there are a lot of forces at work that want to keep it as is. And that's the question. Do we want something different? And he has challenged the orthodoxy in many areas, and many people have faults with him when it comes to vaccines. So it will be, and I think people are just demanding something different. And I think principally with with the food and the chemicals. And I think that is
Yeah.
what has galvanized a lot of people in this country when it comes to RFK.
No question. And, like I've said many times, we are down with food as medicine. We are down with cleaning that food up. We've invested tens of millions of dollars at EWG over the years fighting for that. And I would hate for that opportunity to be lost either because, in fact, the Trump administration won't do anything about it, even with Bobby's in, or be lost because even though he's a spokesman for that, the flaws outweigh the strength of his, of his arguments, and bring him down in that fashion. Robin, I'll turn to you for one final closing thought, and then we'll let people go. Anything you want to add?
Yeah, I would add that it would be lazy for any of us to think that this is one person's job. And do not underestimate everyone's individual ability to engage at the local level. That's where I first started, and it's a powerful place to start. So that would be for anybody that's listening, get involved.
Yeah.
I mean, this is a generational lift that we've got in front of us. This precautionary principle, it hits absolutely every sector, from food to energy to transportation. And I think as we look back, if I think back and I want to be able to reflect on what I leave my grandchildren, I would love to be able to leave them the precautionary principle.
Well said. Well, I'll just close by saying we'll be following up. We'll be tracking the nomination confirmation process as it unfolds, and then it's also our job at EWG to deal with with whatever the outcomes are, track those, and we're very concerned about what's going to happen at EPA, very concerned about what's going to happen at USDA. We're going on the track record of the first Trump administration. Maybe, as Mr. Kennedy has suggested a few times, maybe Trump has changed. We'll see. He did a lot of damage, including to things like school lunch that HHS will have a little bit of purchase on through the dietary guidelines, but it's a USDA-run program. We'll be looking at pesticides, which Bobby won't be able to do much about except monitor their presence in the food supply. That's mostly what FDA does. And we look forward to maybe continuing this conversation with all of you at various phases as this unfolds and we see how the nomination process for Robert F. Kennedy Jr. And how the story ends and what happens in the aftermath. But I want to thank Jen, North, Max, Robin. Thank you so much for taking time. This was commentary no one was getting elsewhere, I think, in this process of Mr. Kennedy's confirmation. For all its highs and lows, I'm really grateful that you were here to talk to us about it and give us your perspective.
Thank you so much for having us.
Thank you, Ken.
All right, more to come.
Thanks.
Hang in there. Thanks everyone for listening.